There's an amendment at the desk. The clerk will report the amendment.
Munson moves to amend House File Number 2414, first and Grossman as amended. The amendment is coded A19-0465.
Call on the amendment, the author of the amendment, Representative Munson.
Thank you, Madam Speaker and members. As I was in deep reflection here, wondering who the sucker is going to have to stand up and talk after those deep bills. It's me. I've got a couple of bills I'd like to talk with you about. This first one, Amendment 465, both of these bills deal with the navigators that are laid out in existing law, and one of which is being amended with today's bill. If you want to pull out the bill, you can follow along. I'll pull up my pocket version here. On page 516, under a section entitled Incentive Program, there's language that discusses the navigators and how they're paid. And for those of you who don't know what the navigators are, most of the benefits for these programs are determined at the county level. But in order to evidently assist the county in granting benefits to these beneficiaries, we've decided to pay navigators, people that would sit in Walmarts and sit outside the grocery stores and sign people up for benefits. And the incentive program pays people currently $25 for every person that signs up for Minnesota Care. And this bill attempts to increase that cost to $70. Well, I sat on the HHS Policy Committee last year and heard testimony from one of the navigators who set up kind of a network of navigators and was paid hundreds of thousands of dollars, taxpayer dollars, to sign people up for benefits. And as we look at the numbers in the periodic data matching report that shows, 10% of the people that are signed up for medical or for Minnesota Care aren't qualified to receive those. We need to look at determining where this level of fraud, my arm is getting sore, I got to put this down. We need to find out why we have so much fraud in our system. And that's because we're not doing our due diligence in signing people up. The Navigator program doesn't just double the fee, it's actually almost tripling the fee for signing people up for Minnesota Care. So we need to look at why we have so much fraud in the system, so many people getting signed up for services that aren't qualified. It's because we're paying people to sign people up for it. And not just county employees that have to follow their due diligence, but we're incentivizing people to get more people onto a system that they may not be qualified to receive these benefits, as the data shows. So this First Amendment, 65 Amendment, let me just double check here, would remove not only, this First Amendment actually, if I can read what it says under this program, besides paying navigators now $70 is the proposed amount, the sentence follows, it says, the organization or licensed insurance producer, which is the navigator, may provide an applicant a gift certificate or other incentive upon enrollment. So we're not just paying the navigators, but we're actually allowing the navigators to pay the people that are being signed up for these services. So as you see, imagine a family or somebody walking into a grocery store to get their groceries, and somebody says, hey, can I talk to you for 5 minutes? And if you fill out this paperwork to get these, for this free service, I'll give you a $20 gift card for your groceries today. So we're not just paying the navigators to sign people up, but we're allowing the navigators to pay the recipients to sign up for services that many of them are not qualified to receive in the first place. It's one thing to attack fraud after looking at the data after they're already signed up, which we actually aren't prosecuting a lot of it. But we actually are creating a program, we have created a program that builds on this fraud. So this amendment, members, isn't to change the fee that we're paying navigators or we're going to pay navigators. This First Amendment is just to prevent the navigators from paying people to sign up for services. And if you don't see that that's a program that designs fraud, I don't even know where to start. So please, members, if you could allow us to change this one part of the Navigator system so we stop paying people to sign up for services, I would be grateful for this first attempt, and I'll stand for questions. Thank you.
Discussion to the amendment, Representative Loeffler.
Well, thank you, Madam Speaker, and Representative Munson. I know you're new to the committee, and it's a big area to learn a lot about. A navigator can be a nonprofit, but a lot of this was put in law actually because the insurance brokers wanted to have a role, because when people come to them, maybe they get their car insurance from them. When they have a need for health care, they'll help them, whether it's for a public program or a private program. And, this is not an issue that we've heard of since it's been in law since 2008, that there's any problem or even how it's being used. We think it's something that's better addressed in a hearing, so that we can actually hear from the insurance brokers and how they use this. I know oftentimes when you buy a new car and you sign up for car insurance with your broker, they send you a coupon for a free car wash. I don't know if you get a first aid kit or what you get out of these things, but I think we ought to know that before we decide that this is an inappropriate thing. And I'd welcome having a hearing on this so we could learn more. I'd urge a no vote.
Representative Munson.
Thank you, Madam Speaker, and thank you for that comment. And I think you're absolutely right. This was, we're creating MNsure, and we're kind of taking business away from insurance agents. In fact, my insurance agent that I used to buy private insurance from through Blue Cross kind of got out of the business because everything was done through MNsure. And this was a way to continue to give them a little bit of a payment for helping people through the MNsure website. But where you design a program that was well-intentioned to start with has attracted fraud to the program, as proven in the periodic data matching, where over 10% of Minnesota Care enrollees in Minnesota, the taxpayers are helping to subsidize for, are not qualified to receive these benefits. And so we need to look at why we're having so much fraud, and this is a reason why. So it wasn't just insurance agents that were getting these fees. Once we created a program and kind of rang the bell for people that want to steal money from us, they flocked to this legislation and said, look, we could just set up a table outside Walmart and sign people up all day long, and we could pay them half of what we're getting, and everybody wins, except the taxpayers. So we've seen the results of what this program does, and all I'm saying is that we should stop. This First Amendment isn't saying we're not going to pay the insurance agents. They still get their fee. This thing is saying that we should stop allowing people to pay the enrollees to come and sign up for the free stuff. That's what we're saying. We're just like when we see credit card companies setting up shop at the University of Minnesota and the McDonald's and says, sign up for a credit card and you get a free bag of M&Ms or we'll buy you lunch today. It creates a deceptive business practice, and I think we should look at this as one of the conduits for fraud in the state. Stop allowing navigators to pay people to sign up for services. Maybe that's a good thing we should do to stop fraud. So, thank you, and I would urge an affirmative vote for this.
Seeing no further discussion, all those in favor say aye. Aye. All those opposed, nay. No. The motion does not prevail. The amendment is not adopted. There's an amendment at the desk. Representative Munson offers the following amendment. The clerk will report the amendment.
Munson moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A19-0466.
Call on the author of the amendment, Representative Munson, to report the amendment, to talk about the amendment.
Thank you, Madam Speaker. Members, this will be quick. This one changes it keeps the existing $25 payment for navigators instead of more than doubling their fee to $70. As I mentioned, there's navigators out there that started with the full purpose of just to collect this money, and they're making hundreds of thousands of dollars. The counties should be also signing people up for services and not just relying on these nonprofits to take dollars from taxpayers. So thank you.
Discussion to this amendment, Representative Loeffler.
Thank you, Madam Speaker and members. This impacts insurance brokers and navigators. The enrollment payment that they get for helping someone get into a public program has not been increased, I don't believe, since 2008. We have heard repeatedly from this. This does not begin to cover the time that they spend. We ask everyone who applies for our public programs to bring in birth certificates, paychecks, copies of every bank statement they've ever had, all kinds of documentation. It usually takes several different meetings to get them through the process, and $25 does not begin to cover the amount of time that it takes to help a family get covered so that their kids can have health care. This is a minor amount of money, and if you can talk to any insurance broker who's gone through the certification and training program, these are not people who can just suddenly decide, I want to go in front of a Walmart and start having people fill out applications. This is after they have been enrolled, so they have to be successful. That means all of those documents have to have been submitted and reviewed and approved before anyone gets paid. These are not amateur hour efforts. These are professionals, either in insurance brokers or trained navigators, and $25 doesn't begin in today's efforts to cover the time that they have to spend to get someone through the process, get all the documents submitted, and deal with getting a family enrolled in our public programs. I'd urge a no vote.
Seeing no further discussion, this will be on the 0466 amendment. All those in favor say aye. Any opposed, nay? No. The motion does not prevail. The amendment is not adopted. Representative Munson offers the following amendment. The clerk will note the amendment.
Munson moves to amend House File Number 2414, first engrossment as amended. The amendment is coded A19-0468.
Call on the author of the amendment, Representative Munson.
Thank you, Madam Speaker and members. This is an interesting one. I think you'll like this one. This has to do with the provider tax, which on this side of the aisle we like to call the sick tax because we recognize that people that are sick pay it. And there's been a lot of discussion, a lot of support from outside this chamber that people support the provider tax because it does great things. This is a moment where we can agree that you're doing good things with the money from the Healthcare Access Fund, but I would like to follow suit with what 24 countries around the world do to help pay for health care, which is to use the sin taxes in our state to pay for it. So the healthcare access, or the provider tax, brings in about $462 million a year and is used in the Healthcare Access Fund. We bring in $534 million a year from liquor and cigarettes and tobacco taxes and revenue. So this amendment would just take our sin taxes. So instead of taxing people that are sick, we're going to use the existing taxes on alcohol and tobacco and the tobacco lawsuit money and put that into our Healthcare Access Fund. Instead of taxing our sick, which is immoral, let's just use the existing revenue on alcohol and tobacco to pay for our Healthcare Access Fund. And members, that's a pretty simple amendment. And I think that this is a great use of existing revenue, and it's what Canada and much of Europe does to help pay for their health care. So members, I would like a yes vote on this amendment as well.
I call on Representative Carlson.
Madam Speaker, a point of order 4.03. This would take dollars from the general fund and deposit them in the Healthcare Access Fund, and it would be in violation of the House budget resolution as established by Ways and Means.
I rule the point of order well taken. There is an amendment at the desk. Representative Schumacher.
Schumacher moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A173.
Madam Speaker.
Representative Albright.
Madam Speaker, Representative Schumacher is momentarily delayed. I'm wondering if we could just temporarily lay this aside and move on to the next. Madam Speaker,
Representative Albright.
if you'd oblige me, I'd like to explain the amendment.
I'm sorry, Representative Albright, if you just repeat that.
Would it be appropriate for me to explain the amendment?
That is appropriate. You may go ahead.
Thank you, Madam Speaker. Members, the A173 amendment, excuse me, deletes a number of fee increases throughout the bill. By the count that I have on my sheet, there are more than $2.6 billion raised from new and increased fees and taxes in this bill. This includes the provider tax, new fees on assisted living, new fees for insurers to apply for network adequacy waivers, a new tax on insulin manufacturers, increased fees on home and community-based providers, increased fees on drinking water, and much more. Members, I'm sure this amendment missed fees and taxes throughout the bill that are there, but we just didn't see them. With $1 billion surplus, the fact that you need to increase revenue more than $2.6 billion to make your budget work is almost laughable. We should be able to fund our priorities without new fees and without raising taxes. Madam Speaker, I think my words speak for the initiatives, but with that, I would withdraw the amendment.
Representative Albright withdraws the A173 amendment. There's an amendment at the desk. Representative Garofalo offers the following amendment.
Garofalo
Clerk will
moves
report
to
the
amend House File Number 2414, the first engrossment as amended, and the amendment is coded A19-0470.
I recognize the author of the amendment, Representative Garofalo.
Thank you, Madam Speaker and members. Members, this amendment would fully fund and pay for President Trump's wall. I ask for your support. No, I'm just kidding. It doesn't do that. So, just want to see if anyone's paying attention. Madam Speaker and members, even though this is the amendment is 20 pages, it's actually a very basic amendment. Right now, there are two different schedules for drugs. Schedule 1 are addictive drugs that have no medical value whatsoever. Schedule 2 are addictive drugs that are found to be addictive that have some medical value. And right now, marijuana in the state of Minnesota is classified as a Schedule 1 drug in spite of the fact that we have a medical marijuana program. And so what this bill would do, what this amendment, would do, is it would reclassify marijuana as a Schedule 2 drug. This is something the legislature needs to do if it's going to change, because in 2011, a lot of people were petitioning the Board of Pharmacy to change the classification of marijuana, and they didn't want to do that. They said, this is a little bit too hot for us to touch. And so in 2011, the legislature and the governor changed the law, so now any changes in these types of drugs have to be done at a legislative level. I think it's fair to say that if you're someone who is agnostic or supportive of the existing medical marijuana program, then you're probably fine with this amendment. If you're someone who doesn't believe that people are benefiting from the medical use of marijuana, you're probably opposed to this amendment. But regardless, I see no harm in Minnesota advocating for the reclassification, the rescheduling of this drug. We can all agree that we need research, we need to know facts to back up our policy decisions, and this provides an example for the federal government. Minnesota can lead the way. And so I would ask for members' support of this amendment, and I'm happy to stand for any questions. Thank you.
Discussion to the 0470 amendment. Representative Liebling.
Thank you, Madam Speaker. Well, I think I heard Representative Garofalo say it's a 20-page amendment. You really want to add 20 more pages, Representative Garofalo. Have you weighed it? Did you weigh the amendment? Because it might be just too heavy to add. But no, enough silliness. Obviously, it makes no difference. Size does not matter. It's okay. Good, now that I have everyone's attention, I would just say that members should make their own decisions. I personally support this idea, and but this bill did not get a hearing. But it didn't get a hearing. I don't think it got a hearing in the policy committee, and it certainly didn't get one in the finance committee. So it hasn't actually been heard in the House. I do think that Representative Garofalo is correct that the Board of Pharmacy isn't actually opposed to this, and it does make sense to me personally. But I would just say to members, vote your districts. Thank you.
Discussion to the 0470 amendment. Representative Gruenhagen.
Oh, thank you, Madam Speaker. Yeah, I rise in opposition to this. I like my good friend Garofalo and appreciate so many things that he does here. But members, it's just getting to be a bad situation where we as a legislature decide to move drugs around on the schedule. We have a process for approving drugs and moving them, okay? And for the legislature to start setting a precedent of moving these drugs around, I think does not serve the public well, whether it be marijuana or any other drugs. I have another rep on my side encourage me to say that not this amendment, but this bill will continue to weigh more until we're not going to be able to lift it off the floor house. No. Will raise health care costs, it'll cut funding for nursing homes, and it doesn't have a lot of controls for fraud, especially in the CCAP area. But besides that, think of it, members, we're setting a precedent to move drugs around on a schedule, and we're all lay people. Now, some of us have a little more expertise in the medical area, but this isn't the way the process should work, okay? We have a system where experts examine this with side effects. So, members, I would encourage you to vote no on this amendment. Thank you.
Representative Mariani.
Madam Speaker, members, and to my good friend Representative Garofalo, I'm going to join you on this, but I do want to highlight something that Representative Gruenhagen said and remind members that on Monday, I think it'll be Monday, our Omnibus Public Safety Criminal Justice Reform Bill will be up, and within that Omnibus bill, there is a task force that's being called for to study our evolving public policy, potentially evolving public policy approach to cannabis that covers a pretty comprehensive scope of issues to address. And so to Representative Gruenhagen's point, even though I support Representative Garofalo's move, I do think it's important that Minnesota has a very careful, deliberate, research-based, objective conversation and exploration on all these issues related to cannabis, and I look forward to our conversation in support of that particular approach when we have that provision before us on the floor of the House on Monday.
Being no further discussion, all those in favor of the 0470 amendment say aye. Aye. Those opposed say nay. No. The motion prevails. The amendment is adopted. There's an amendment at the desk. Representative Munson offers the following amendment. The clerk will report the amendment.
Munson moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A19-0469.
I call on the author of the amendment, Representative Munson.
Thank you, Madam Speaker and members. You're going to love this amendment. This is the Right to Shop Act in an amended form, and made some changes to this bill from where it was originally at, and it's how it's traveling in the Senate. There's some papers that'll be coming around that will be showing the financial cost to it. But the way this program works, and I know that a lot of people in your districts are calling you about the high cost of health care, and all you can kind of say, well, we're working on stuff, trying to get the cost down, trying to get the premiums down. But the bottom line is there's a large discrepancy in the cost of care at different clinics and providers. And as it's been reported, in fact, I included a recent article from a left-leaning news source so that you can find it more trustworthy. This one's from NPR News. On the cost of hip surgeries, where one clinic it might be $12,000 and one's at $80,000 because there's no price transparency out there. So this bill would require nearly full price transparency on all services at clinics so that we can actually see what things cost. There's a lot of price transparency legislation coming through this body and the other body this year. A lot of it's between the providers and the insurance companies, or what the insurance companies are receiving, or pharmaceutical companies. This one actually requires the costs at all the clinics be public. And the greatest thing about this bill is it allows patients to shop for care outside of their existing insurance network, or where the insurance companies dictate they go. My daughter had surgery this morning, but my insurance doesn't cover her surgery. So we were allowed to shop around and find a significantly cheaper cost, but still good quality care. Not everyone likes to shop, and I understand that. But the loudest people who are calling your office, the people who are most passionate about the cost of care, will shop for care. The majority of the healthcare costs are from people that have chronic illness, that are the sickest among us. And this bill would create, for those who want to shop, a shared savings incentive account. So it's an account set up for you, and when you shop for care and you find something cheaper than in your insurance network, the insurance company is going to save money, right? If you're shopping for a service, it's $5,000 in your network, and you find it for $2,500. That's $2,500 less that your insurance company has to pay for that service. This bill, this law, would require that the insurance company has to give you half the savings as an incentive for shopping, as a reward for shopping. So Representative Hamilton, who's not with us today, he's with us, but he's not here today, just to clarify, he pays, I think, $17,000 a month for an infusion for ALS. He knows where it's cheaper, but he can't go there because it's not in his network. If he could save $4,000 a month on a $17,000 service, the insurance company would send him a check for $2,000. Well, it'd put it in his shared savings incentive account every month. So the sickest people in Minnesota could pay for their insurance costs just by shopping for care. This program has been put in place in 4 other states, and in its first year in the state of Maine, it saved tens of millions of dollars with just a small percentage of people shopping for care. I'm not asking for $400 million for reinsurance or buying down premiums. I'm just asking you to give your constituents the right to shop if they choose. Now, the original fiscal note that was distributed here, I just shared the first page because it was kind of a shocker when I got this. It said it was going to cost $12 million a year. $12 million a year. And so if you turn on the back page of this, you'll see $6.2 million was the cost of managing all these accounts. Well, this original bill had said you need to set up accounts for every single patient. Well, not everyone's going to shop, so it costs $4 a month to set up a shared savings account. If somebody really wants to shop for care and they're going to save hundreds of dollars, my bill allows them to pay for that cost themselves. But if you'll see at the top of the last page, not the top, but the first number under the expenditures, it says new costs due to incentive account payments. So this is our state putting this budget together. $5.8 million it would cost the state. But those are incentive payments paid to patients. So this is just for our state health insurance program, which many of you are on. In the first year, it would have to pay out $5.8 million to people because they went out and shopped for care and found stuff cheaper. This $5.8 million, it's rounded up to $6 million, reflects a $12 million a year savings in the cost of care. Half of that is paid to patients, which is why it shows up here. What's missing from this estimate of the cost is the $6 million that the state would actually save because they get they get to save half the costs for shared savings. So you're paying $6 million to patients for them shopping and successfully finding cheaper care, and the other $6 million goes into the insurance pool to save the costs for everyone. This is a program that will drive down the cost of care, and with full price transparency and people out there shopping for care, if Representative Hamilton was to be allowed to shop for care outside his network and went to that clinic that was charging $4,000 less, and other patients did too, guess what? The clinic that's charging $17,000, they're going to lower their cost of care. They're going to lower the cost what they charge. So this bill will not only pay people to shop for care, but it will actually lower the cost of care at clinics in Minnesota. It's what we call in the private market competition in free markets. This bill would empower patients to shop, which is the best incentive to lower the cost of care. And for those people calling your office complaining about how much an MRI costs, an MRI in my area is $3,200 on average, yet there's clinics in South Dakota and Wisconsin that charge $600. Why can't I go there? It's out of network. Your insurance company doesn't cover it. But this bill would allow them to be paid, not just allow them to go there and have the clinic, have their insurance company pay that provider, but they could be paid an incentive to shop, which is a great incentive to lower the cost of care for everyone. Members, this bill would not be enacted until the next biennium. So there's no cost to this biennium. Let's pass this today and get this started so that we can have a great program to lower the cost of care for people in the private market. Instead of going down the path of dumping $400 million into corporations in Minnesota, the insurance industry and the pharmaceutical industry, let's actually empower patients to shop for care based on price and quality, as opposed to where these insurance companies dictate they go. Let's change the course of private insurance in Minnesota. And this bill is a great start. It is proven in other states to work. And I will stand for questions. Madam Speaker and members, thank you.
To the 0469 amendment, Representative Considine.
Thank you, Madam Speaker, and I guess I'm going to break the rules. I believe you said your daughter had surgery this morning. I hope she's doing well.
Discussion, Representative Liebling.
Thank you, Madam Speaker. I echo that sentiment. Thank you, Representative Considine. Well, Representative Munson, I appreciate your passion for this. This is sort of, seems like it's been your work of the session, and to get this in front of people, and I really do appreciate that. I think you're very sincere in your desire to do something to reduce healthcare costs, reduce insurance costs, and so on. You know, even putting it out in the next biennium, you know, we don't have a fiscal note. I think it's a bit unlikely that even if you start this in the next biennium, that there are no costs that you'd have to pay in this. So I would suspect that it actually does break the budget amendment and probably is out of order for that reason. But besides that, even if that is not true, this is just not the kind of thing that you put into a bill when it hasn't had a hearing. I know you've been asking for one. I had told you that I was going to try to have some kind of an informational hearing on this, which you know, I would still like to do along with some other proposals perhaps, but we haven't heard what the pushback of this is going to be. All we know is your great commercial for it right now, which I appreciate, but we haven't heard any feedback from anybody else in the system. So obviously we can't take this now. We're not going to be able to accept the amendment. I think I would suggest to you the better course would be to withdraw the amendment rather than get a negative vote, which I'm pretty sure that you will get if you want to get a vote on it. You know, as I say, I certainly appreciate the approach you've taken, and I think it's an idea worth continuing to talk about. Thank you, Madam Speaker.
Representative Munson.
Thank you, Madam Speaker, and thank you, Chair Liebling. I've really enjoyed being on your committee this year, and I look forward to the discussion. I'll tell you, I mean, there is a fiscal note that we got on the bill without changing the cost of the accounts, and I look forward to getting a corrected one reflecting the actual savings to the state. I will tell you who opposes this bill. There's a lot of opposition. It's every single insurance corporation in Minnesota. every pharmaceutical company in this country hates this bill because it brings full price transparency to our health insurance market so that we can actually shop for care. And that is the biggest threat to the insurance industry and to the healthcare industry, the pharmaceutical industry, is showing people what things cost and empowering consumers. Because when you empower consumers, you can't buy legislation in this body. You can't make big donations to campaign committees to block legislation from being heard and from being passed. So there's a lot of opposition, but I want to empower people to make the right decisions. My wife wants me to get this bill passed so I don't have to be up here. I can go home. Half these people want to get rid of me. Most of you guys do too. This would help. So I'm tempted to take a vote today. But on your recommendation and in the hope that I'll get an informational hearing and can really lay the groundwork to get this done next year, Madam Speaker, I will withdraw my amendment, and thank you very much for entertaining this.
Representative Munson withdraws his amendment. There's an amendment at the desk. Representative Albright offers the following amendment. The clerk will report the amendment.
Albright moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A140.
The author of the amendment, Representative Albright.
Thank you, Madam Speaker. Members, it seems so long ago when I offered the A130. I've even forgot. But members, the A140 is on a similar track. It tries to protect the rural hospitals from the effects that might come into play with the OneCare proposal that's in the Omnibus bill right now. The difference between that one and the A140 is that this one provides for a grant opportunity that would be afforded to those hospitals. Let me just remind you again, since it's been some time since we talked about this, there are 19 rural hospitals that are shown to be at risk based upon the reimbursement rates that are to be considered under the OneCare proposal. That being said, 12 of those are critical in nature due to the service that they provide to their communities. And so all this is suggesting is that we put together a pool of money, and in this case, offering grants to those cities to afford for a bump in their P&L for the revenue that is not being generated based upon the reimbursement rates. I would certainly encourage support of this so that we can show in good faith our support of rural hospitals. Thanks, you members.
Discussion to the A140 amendment, Representative Hlth.
Thank you, Madam Chair and members. I urge a no vote on this amendment. It's not a good idea to use grants to establish hospitals and clinics. Thank you.
Seeing no further discussion, all those in favor say aye. Those opposed say nay. The motion does not prevail. The amendment is not adopted. There's an amendment at the desk. Representative Baker offers the following amendment. The clerk will report the amendment.
Baker moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A135.
The author of the amendment, Representative Baker.
Thank you, Madam Speaker. We want to talk a little bit right now about dental care and how critical this is in all of Minnesota. I know our bill does some changes with formulas, but what this also does is it takes away critical access to our dental providers that are trying to give access to the people that need it the most. So this amendment restores that critical access to dental rates. We heard repeatedly in committee about the impact these cuts would have on dental providers. Since this bill was even passed out of the HHS committee, I have heard more stories about how these cuts will hurt dental providers that are trying to do everything they can to support these patients. At least one dental group has told me that they can't do this any longer because the cuts and the reimbursements are so low. In my area out in Wilmer, we have a terrific hospital program under the University of Minnesota umbrella. We have a dozen students every 2 weeks come out and turn over, and they serve the neediest of folks in our area. The hospital, because the reimbursement rates are so low, are having a challenging time keeping that open. And even with free dental students providing cleaning and dental services, they're still losing about $200,000 to $300,000 every year under that hospital that we are supporting locally. So members, Madam Speaker, I would like a roll call on this if I could, please. This is an important vote on dental support.
A roll call being requested. Seeing 15 hands, there is a roll call.
Thank you, and I
Representative
would
Baker.
appreciate a green vote.
Discussion, Representative Liebling.
Well, thank you, Madam Speaker. And the program does change the way dental care is paid for under medical assistance. And you should know, by the way, that the other body is getting rid of all the money for adult dental care. So if you don't like this, you'll like theirs a whole lot less. But be that as it may, one of the things that is happening in the bill as it is right now is that it is adding $54 million to pay for dental services in 22-23. So if you vote for this amendment, you are voting to remove that money. And you're voting to really squash any opportunity for us to go forward and figure out a better way to do this. So, yeah, we haven't yet arrived at the perfect way to do the rates. But let's be clear, over the last several years in this body, we've all struggled with this. How to make sure that people who are getting these benefits, who we are paying for their care, a capitated amount for many of them, under medical assistance, and we're not getting the kind of results we should be. There's a very low access to care and not the results we should see. So members, you need to vote no on this, because if you vote yes, you are taking away the opportunity in this bill to actually increase rates and do much, much better for people who are on medical assistance, because dental care is extremely important. If you have bad teeth, it impacts your health. And it's a really foolish savings for us not to be doing our best to give people opportunities to be healthy and have healthy teeth. If we don't do that, they go to emergency rooms and it impacts their health, and we pay for that under medical assistance. So I urge you to give this a red vote.
Representative Zerwas.
Thank you, Madam Speaker and members. Members, Representative Liebling is right in that $54 million is shifted around in the bill in the out years and will help to increase all the dental base rate for all dental providers. The challenge is the bulk of those dentists are not currently and most likely will not in the future see Medicaid patients. The state of Wisconsin tried this. I think they put $80 million in, and when in a pilot for her, they had an 80% increase in their dental reimbursement base rate in a pilot project, and they ended up abandoning it because access didn't increase. What this does, by scraping out critical access dental and those dollars and those add-ons, is for those providers that specialize in the uninsured, especially uninsured in underserved communities and in greater Minnesota. They'd lose their rural add-on, they'd lose their pediatric add-on, and they'd lose their critical access add-on. Yes, their base rate will go up. It will go up. But the net effect will still be a 20% rate decrease for the bulk of the providers that are delivering the bulk of the care to underserved Minnesotans. And so I've worked with Chair Liebling on dental issues over the last at least 5 years, and I know what she wants to do and what she wants to get at is raising access and improving outcomes for our patients. I know that's where she wants to go. I know that's where her heart is. This plan isn't ready. It doesn't address how to do that. Now, the author of the bill would probably say, as she's told me before, we have multiple years until this goes into effect. And so we have time to figure out the details and implement this. Well, members, one thing Representative Liebling likes to say at committee is when you have a really great idea, but perhaps, just perhaps, it's not ready for prime time. And I think with this dental provision, it's not ready for prime time. I think there are providers that are scared that they're going to close up shop and that they're going out of business. There is no need to scare dentists who have made a career out of serving underserved populations. It does us no good. So let's hit the pause button on a proposal that isn't ready for prime time. Let's work on this in the interim, and let's address it in the next year when we've actually had a chance to come up with Plan B. I don't know how many fans of South Park we have as members, but there's an episode that is step 1 of the plan, step 2, gets a little fuzzy, and then step 3, make money. Well, this is literally the underpants gnomes of dental reform. This is not well thought out. They want us to scrape out all of the add-ons up front. We'll figure it out. And then we'll save money and serve more people. Well, members, step 2 is pretty dang important. And there is no step 2 in this bill. So let's push pause. Let's figure out an actual plan, and let's address it. Thank you, Madam Speaker.
Further, Representative Liebling.
Well, Madam Speaker, the problem is that voting for this amendment doesn't push pause. Voting for this amendment puts a dagger through adult dental services in this state under Medicaid because the other body, as I said, zeroes it out. So if you want to go to conference with a 0 on one side and nothing on the other side, you're going to get the zeroing out. So members, please vote no.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. Seeing 48 yeas and 74 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk, and the clerk will report the amendment.
Gruenhagen moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A129.
The author of the amendment, Representative Gruenhagen.
Oh, thank you, Madam Speaker. Members, if you like socialism, this is the amendment for you, okay? But basically what it does, it deletes the one care plan altogether, and it replaces it with the DFL House Single Payer Health Scheme. Members, you should probably understand a few things before you consider voting for this, and I would recommend a red vote on our side of the aisle. By the way, members, I would like a roll call on this, Madam Speaker.
Roll call has been requested. Seeing 15 hands, there will be a roll call.
Just a couple things to consider, members. Back in 2010, our state demographer did a study, and basically he came up with, if we do not get the cost and growth of government health care under control, we will see three things happen in the future. One, the the growth of government health care will eat up all additional tax revenues. And therefore, according to our state demographer, Tom Gillespie, who's now retired, there will be no additional money, members, for roads or bridges, K-12 education, or higher ed. Do you understand that? If you vote for this bill, you're going to wind up with a situation that, well, there'll be no additional money for roads or bridges, K-12, education, or higher ed. Members, remember, there's been an analysis done of a single payer in this state. The latest analysis says it'll cost $35 billion per year to initiate a single payer. That's $70 billion every 2 years. And every estimate of government spending on health care is low. It usually doubles and triples over a period of a couple of years. Madam Speaker, I did request a roll call, right?
Representative Grudhagen, you did.
Okay. The other thing to keep in mind, California, one of the most liberal states in the nation, looked at implementing single payer, over $400 billion a year. They decided it would bankrupt the state. Of course, they're already bankrupt. Vermont did away with their single payer plan. Members, the expansion of government health care under Obamacare in our state and across this nation, of Medicaid, has resulted in the closure of rural hospitals and hospitals in general at the fastest rate in 30 years with no end in sight. We also have seen numerous medical professionals leave the profession since the passing of Obamacare. We see the cost of Obamacare exploding way past what it was projected by billions of dollars. And then on top of that, we see in our own state an exponential increase of uninsured individuals. Members, that is what you're looking at when you want to go down the single payer road. It's a primrose path that brings false promises and lies, even worse than what Obamacare did. So members, if you want to support less access, higher cost, and ultimately a two-tier healthcare system, one for the rich and the privileged and a second-rate one for the rest of us, this is your amendment. You say, Glenn, that's just your opinion. Well, on the way back from Florida a couple years ago, I sat by a cardiologist from the Cleveland Clinic. That's a world-famous heart surgery clinic. As I was reading a book on healthcare, he and I opened up a discussion. He had been a cardiologist for over 20 years. So I asked him about single payer, if it would produce rationing. He said, absolutely. Now, his view was, he had been a cardiologist for 20 years. He said, this is how he thought it would work. He said, they're not going to come to me as a cardiologist and tell me I can only do so many surgeries a year. He said, they won't do that. What they'll do is they'll limit the amount of tests that I can have my patients take. So in other words, before he could do surgery, heart surgery on his patients, he has to have so many tests done to make sure that the patient can survive the surgery. And according to him, they're going to limit the number of patients per year that can have those tests, thereby limiting the number of surgeries. That means patients who need the surgeries are going to be put on a waiting list. And then I ask him, do you think healthcare employees and professionals, along with rich people, are going to butt in line? He said, absolutely, that will happen. And there'll be money passed in order to move up in the line to get the health care you want. That's what you're voting for on the single payer plan. That's what you're foisting on the people of the state of Minnesota if you want to go down that road. The other doctor that I could refer you to is Dr. Carisco. He worked in the Canadian system for years. He believed in socialized medicine. He moved to Minnesota in the United States because he got so frustrated with it. He was trying to update his equipment, and you have to petition the government, and they kept declining. So his medical testing equipment was breaking down, and he had to put patients in a line. One of those patients was his brother who had sinus problems. He told his brother, go to the U.S. Well, his brother didn't want to do that or didn't have the money to do it, so he stayed in Canada waiting in line. Well, finally it got so bad he decided to go to America to get the test. He had cancer in his sinus area, okay? And Dr. Carisco couldn't do the test to find it. So he did get treated, he did recover, but it could have been fatal. Also, he had a patient, one other patient who had back problems. They got put in a line. Turned out it was a cancerous tumor. By the time they got at it, it was too late. Those are just a couple of his stories. He finally threw up his hands, and he was a believer in socialized medicine and moved to the United States. He wrote a book against socialized medicine, the end of the Second American Revolution. If you'd want to purchase the book, it's an excellent read. So members, I don't want a two-tier healthcare system. I don't want a healthcare system that eliminates all future funding for K-12, higher ed, or roads and bridges. I hope you don't either. So members, I think we should vote red on this amendment and send a strong message to Minnesota, our healthcare system, and that we want to continue a great healthcare system, create access, and have more doctors, and give our patients, especially the critically ill, the health care that they need. Please vote red, members. Thank you, Madam Speaker.
Representative Liebling.
Well, thank you, Madam Speaker. I just want to clear something up. There is no single-payer health care plan in this bill, just so people are really clear on that. But Representative Gruenhagen talked about a cardiologist from the Cleveland Clinic. Well, I'm married to an internist from the Mayo Clinic, and he really likes single-payer, but we'll leave that aside. Members, I hope that at some point we will be doing single-payer. I think we could do a whole lot better for this state, but we're not doing that today. And so I'm going to ask members to vote no, because for one thing, it would put our bill out of balance. We haven't had hearings on it, and we're just not ready to go yet in that direction. I hope that sometime we will be, so please vote no.
Seeing no further discussion on the amendment, the clerk will take the roll. The clerk will close the roll. Seeing 4 yeas and 123, Hornstein votes no. Seeing 4 yeas and 124 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk. The clerk will report the amendment.
Davids moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A164.
To the author of the amendment, Representative Davids.
Thank you, Madam Speaker and members. This amendment deletes the premium subsidy program instead of extend reinsurance. We know reinsurance works in 2018 and 2019. On average, it reduced premiums by 20%. Well, the new plan is flawed in this bill. It requires 50 new employees at MNsure. It requires a new IT projects at MNsure. It doesn't help anyone who gets a premium tax credit. It doesn't help people who are buying insurance outside of MNsure. It actually causes premiums to go up in order for MNsure to get a bigger payment. And do I need to say that this provision of the bill writes checks directly to insurance companies? Let's stick with what we know works. We have, again, Angie Craig, Congresswoman Craig, and my good friend Nancy Pelosi, Speaker of the House, supporting reinsurance. And of course, we talked yesterday a little bit about Senator Klobuchar supporting it. So I'd appreciate your support and appreciate a roll call.
A roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Schultz.
Thank you, Madam Speaker. And members, I urge a no vote. This is actually out of order due to the budget costs to the Healthcare Access Fund, according to Rule 4.03H.
Representative Schultz, are you raising to a point of order?
I'm rising to a point of order, correct?
Please state your point of order.
So my point of order is that this amendment, Amendment A164, is out of order due to budget costs to the Healthcare Access Fund, according to Rule 4.03H.
I find Representative Schultz's point of order well taken. There is another amendment at the desk. The clerk will report the amendment.
David's moved to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A116.
To the author of the amendment, Representative Davids.
Well, thank you, Madam Speaker. Members, this one really has no fiscal impact that I can see. We're just simply renaming the premium subsidy program One Minnesota Writing Checks to Insurance Companies. Just about every single one of you have to realize that what this bill does, in this bill, they're going to be hiring 50 new employees at MNsure to write checks directly to insurance companies. Now, we just went through an election cycle where the reinsurance bill supposedly wrote checks to insurance companies. Of course, there's nothing further from the truth. So members, we need to rename this program to One Minnesota Writing Checks to Insurance Companies. Appreciate your support.
Representative Liebling.
Thank you, Madam Speaker. Well, I know the truth hurts, but members, just vote no.
Representative Davids.
Thank you, Madam Speaker. I'd like a roll call.
With the roll call being requested and seeing 15 hands, there will be a roll call. With that, the clerk will take the roll. The clerk will close the roll. Seeing 47 ayes and 77 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk and the clerk will report the amendment.
Cagle moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A19-0455.
To the author of the amendment, Representative Cagle.
Thank you, Madam Speaker. Members, I'm bringing this amendment forward due to a very unfortunate situation in my district. What this amendment would do is direct the Commissioner of Human Services to close a state-run operated community service program in Coon Rapids. We've had a lot of very unfortunate incidents at this home, and many of the community members, neighbors, and our police chief, fire chief have all been trying to work with DHS for a number of years, and with no success. And so this kind of is the resolution that we're looking to, is just to close this house down. And I appreciate your support.
Representative Stevenson.
Thank you, Madam Speaker, and thank you, Representative Cagle, for bringing this very important amendment which addresses a long-standing problem with a specific DHS facility located in Coon Rapids. I want to give the body a little bit of background. The facility we're talking about is a single-family home located in a residential neighborhood. It houses one individual, and costs the state of Minnesota over $1 million every year. The individual housed in the facility, sadly, is prone to violence. As a result, the facility has been hardened. It now includes a safe room that DHS staff can retreat to when the resident is out of control. And when that happens, DHS staff calls the Coon Rapids Police. Members, in the first quarter of 2019, the Coon Rapids Police have been summoned to this facility 19 times. 19 times in the first 14 weeks of the year. On May 23rd, 2018, the individual left the facility without permission and was tackled in the street in this residential neighborhood of Coon Rapids by DHS staff. As they waited for police response, the resident shouted, "I will shoot you in the face," to his neighbors. On March 29th, 2019, less than a month ago, The resident attacked a DHS staffer inside the facility without warning or provocation. He grabbed her by the hair and shook her head violently for 5 to 10 seconds. Members of this legislature have received repeated complaints from DHS staff about this facility, how it's unsafe to work in. Members, for 3 years, the City of Coon Rapids has worked diligently with DHS to try and address this problem. But DHS has refused to do anything but continue with the status quo. The status quo isn't working. Time and time again, DHS has expressed their concern that if the facility is closed, that DHS might get sued. I don't know if DHS would get sued, but I'm here to tell you there are worse things in this world than a lawsuit. Right now, DHS is putting the Coon Rapids Police Department in an incredibly dangerous position, and you don't have to be an expert in law enforcement to see that. The resident has made frequent threats to kill DHS staff and recently has threatened to kill police. At some point in the future, we're going to have a tragedy, and it's avoidable. We could avoid it. And so I urge the body to support the amendment.
Madam Speaker.
Representative Long.
Point of order,
what
Madam
purpose do you
Speaker.
read?
A raise for a point of order.
Point of order. State your point of order.
Madam Speaker, this is out of order under Rule 4.03H for causing the budget resolution limits to be exceeded.
I find the point of order well taken. There is another amendment at the desk. The clerk will report the amendment.
Petersburg moves to amend House File Number 2414, the first engrossment as amended. The amendment is coded A141.
To the author of the amendment, Representative Petersburg.
Thank you, Madam Speaker. This omnibus bill on steroids is large enough that you would think that it would have everything in it that it could possibly be and have everything fixed. But no, it does not. It has some major flaws, and in my opinion, it has 3 of them. The first one is that in my opinion, it does indeed create increased costs to health care. And we've tried throughout the day to give some opportunities to reduce some of that cost. None of them were taken. The second flaw is that indeed report after report and analysis after analysis says that there is rampant fraud and abuse throughout HHS programs, ones in which we really should do something about to save us some money. But the third one, which this amendment really does, and I know, Chair Liebling, that you've heard these bills, and I think something that you do have some passion for, deals with the funding cuts for nursing homes and other care facilities. Well, this particular amendment deals with facilities that serve people with developmental disabilities, the intermediate care facilities. These facilities are licensed, supervised living facilities and serve anywhere from 4 to 64 persons. The people they serve need a 24-hour plan of care and continuous active treatment, sometimes intravenous, feeding, etc. These are truly some of the most vulnerable people in our state. Yet the facilities which are expected to care for them sometimes have tragically low daily rates. One facility in my district, the Kaplan Woods Care Home, is paid just $188 per client per day. This is among the lowest. I believe it was the 3rd or 4th lowest in testimony in the state. We had a fix in last year's supplemental budget for this facility with a couple others, and this year Chair Liebling heard these bills, which would have fixed the rates at my facility and several others. So this amendment specifically addresses each of the facilities which testified in HHS finance about their need for higher rates. They include facilities in Representative Becker-Finn's district, Representative Sauk's district, and Representative Vogel's district, and they're certainly welcome to talk about theirs in a minute as well. We go one step further, though. We allow facilities to receive rate adjustments from DHS when they truly need more resources. Again, these facilities are assisting some of our state's most vulnerable people and are often just barely scraping by to do so. We've heard that these facilities are starting to get outdated and people aren't using them anymore, yet my facility in Steele County just admitted a 15-year-old. And so it's not just those that are aging, they are indeed growing. And the facility in my district is getting $188 per day. Just 30 miles away, the same type facility is getting $400 a day. That's quite a difference there and something that we need to deal with. Where is the funding coming from? Well, this amendment would fund the dollars from the increase in the sex offender program that is being appropriated to make this possible. It really should be, in my opinion, we should be prioritizing the most vulnerable of the vulnerable in our area before we start putting money into a sex offender program that we aren't really sure about the needs. So I would ask for your support. You know, earlier today, Representative Pinto said we shouldn't pit one vulnerable kid against another. In this case, we shouldn't pit one care facility against another. Representative Gomez yesterday really pushed for a living wage for all, but without these increases, that won't happen in these facilities. So I'm asking for your support, and Madam Speaker, I would request a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call. Representative Liebling.
Thank you, Madam Speaker. So this might be under the rubric of let no good deed go unpunished. I don't know, because I did give a hearing to these facilities after some members came to me and told me about their particular facilities and the difficulties they had. It happened. You know, we are doing a lot in this bill for people with disabilities. This is a great bill for people with disabilities. And there is no question that we have a problem across our system, and that a lot of the way we pay for stuff is kind of without rhyme or reason. And some of that is getting fixed in this bill for a lot of the disability community. And by the way, those of you who don't want to cut nursing homes, they're getting a lot of the money. And we need to rebalance the system so that we can make sure that we have sustainable programming. So these facilities that Representative Petersburg is referencing, there's no question that they've somewhat been the unwanted stepchild of the system. And the commitment that I have is to move forward and try to, and DHS is willing to go forward and try to figure out a system for funding them so that it doesn't depend on whether you know your legislator or whose district you live in and whether they're in the majority or the minority. That is not how we should fund disability services. And yet that's what's really going on here, because it's just a matter of who's got the wherewithal to come and talk about it and raise the issue. So the other part of this so I'm not saying this is an unworthy cause, but I am saying that we need to vote this down. And I'll give you another reason why we need to do that. The funding source in this bill, the Minnesota Sex Offender Program, that's a cause that everybody loves to hate, and it's pretty clear why. And I'm going to just discuss this for a couple of minutes because a lot of these amendments use this same source, and I'll only have to do it once. But the Minnesota Sex Offender Program, as members know who've been around for a while, we are actually keeping locked up many of our most dangerous sex offenders under the guise that we are treating them. They are receiving treatment. That allows us to lock them up and keep them there for treatment after they've served any sentence that they would have. So, because of that, we have to keep this, we have to fund this program. It is not optional unless you want to just close down the program, let people return to your communities. That would be an option. It's not my choice. So while we have this program, we have to fund it. In the bill, there is no funding for new staff, which frankly we should be doing because there are staff shortages. The funding in there is to really keep essential services, to keep them from losing staff and to keep them meeting court requirements. If we do not appropriately fund this program, at some point the court will shut it down, and we came awfully close to that a few years ago. So this is not an option. I know it makes a really good postcard to say, oh, members preferred sex offenders over people with disabilities. You can write that postcard all you want, but if we don't fund this program, members, you will have a much bigger problem than that. And so I hope that members cannot politicize this program. We all want to keep Minnesotans safe, and we all want to keep the staff that's working there safe. And we cannot afford to do this because we will lose staff, and we're already in kind of a short-staffed situation in the program. So members, please vote no. And I'm going to, without repeating this whole speech about the sex offender program, any of the other amendments that depend on funding from that, I'm going to ask you for the same thing. So please vote no.
Representative Petersburg.
Thank you, Madam Speaker, and thank you, Chair Liebling. You and I are kind of on the same page with what needs to be done in the future, and I appreciate you working on getting a way in which we can actually get some sort of increases built into the system to deal with this in the future. The problem is that these independent care facilities have the need now. We're uncertain about what the needs might be for some of the sex offender programs. We're uncertain about some of the other things, but they need these dollars now. This is the time for us to really talk about how we are responsible for living wages for those that are working with our vulnerable adults, whether or not we are going to be fair and equitable to everybody in this community in our state. So with that, I would ask you to please vote yes. We know that there's difficulty with a lot of funding pieces. I know that your chair really says yes. A vote no, but please do vote with me and vote yes. Thank you.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. Poppy votes nay. Seeing 54 yeas and 75 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk, and the clerk will report the amendment.
McDonald moves to amend House File Number 2414, the first and gross one as amended. The amendment is coded A19-0473.
To the author of the amendment, Representative McDonald.
Thank you, Madam Chair. Well, due to the fact that this bill will raise the health care cost, cut funding to important nursing homes, and will allow rampant fraud to continue, and the fact that I'm hungry, I'm going to retract this amendment and offer it next year.
The amendment has been withdrawn. There is another amendment at the desk, and the clerk will report the amendment.
Erdahl moves to amend House File Number 2414, the first and gross one as amended. The amendment is coded A151.
To the author of the amendment, Representative Erdahl.
Thank you, Madam Speaker. And so I don't forget, I'd like a roll call.
Roll call has been requested. Seeing 15 hands, there will be a roll call.
Thank you, Madam Speaker and members. This amendment establishes a grant program to address mental health issues, including post-traumatic stress disorder, PTSD, among firefighters, first responders, and veterans and their families. Grants offered through this program will be used to provide training for service dogs, for firefighters and responders suffering from PTSD, provide educational classes on PTSD, and support services to spouses and firefighters and responders suffering from PTSD, or provide mental health services for referrals to mental health services for firefighters suffering from PTSD. This will lower health care costs by addressing needs before they lead to crisis. In firefighters, PTSD rates may be heightened more so than other professions. Studies have found that between 7% and 37% of firefighters meet criteria for a current diagnosis of PTSD. Our state auditor announced that the amount paid in survivor and disability benefits increased by 100.1% between 2016 and 2017. In other words, this is a problem that is growing exponentially. They need our help. Imagine the horrors that these people face and have to live with. Rushing into a burning house, cutting bodies out of cars and wrecks. I was a teacher. I painted houses in the summer. And I remember once painting a house, and a little 5-year-old boy was there. And I gave him a paintbrush, and he could help me paint a window. He painted the glass, but then I finished the house, got paid, left. 2 days later, I get a phone call from my wife. I'm at my school, and she says, "The house you just painted burned down this morning." The little boy, his sister, his brother, his mother, all burned to death in the building. I've met and talked with firefighters who were there, and the memory of that event is still seared into their memories. People who risk their lives and safety to save the lives of us and our fellow Minnesotans are hurting. Now, in my bill and in this amendment, we fund these important grants, asking for $400,000 by reducing an increase in funding, yes, Representative Liebling, for the sex offender program, which is $16 million in new money. I'm asking for a tiny slice of the $16 million to help the people who are saving lives in the state of Minnesota and are suffering as they do it. The firefighters and responders who risk their lives for each and every one of us, or Minnesota sex offenders. Yes, that is the choice. Now, I want to also ask you to think back maybe to a Beatles song. And let's imagine some things. Let's imagine that there are no parties. Imagine there is no caucus. Imagine that there is no leadership telling you how to vote. Just imagine that you could do what you thought was right no matter what it was. And that you went to a house in your district knocking on doors, and the person who answered the door told you the story that I just told you. And they said to you, "Will you help these people? Will you help these firefighters and these responders who are facing such great mental anxiety in many cases? Will you help them? Or will you give some money to sexual offenders?" Not that that isn't an important program, but I'm just saying that I think it can spare that little slice I'm asking for to help the people who are risking their lives, to help the people of the state of Minnesota. Thank you.
Representative Liebling.
Thank you, Madam Speaker. Well, certainly it is compelling that many of our firefighters and other of our emergency personnel are in need, and that is certainly a compelling thing. I would note that the bill does not apply to EMS, so some of the people who actually end up rushing in first are not covered by the bill. But nevertheless, members, we had to make choices. The bill actually does quite a lot in the area of mental health. It really makes a lot of improvements, and those improvements will help everyone. So, you know, I know every member on the floor, this is just the nature of omnibus bills. There's a lot you like, and there's always a disappointment when your particular program didn't get in. I do want to just correct one thing. Giving money to sexual offenders, we are not doing that. We are not giving money to sexual offenders. We are keeping a program and keeping our constitutional ability to have a program that locks up some very dangerous sex offenders. So please let's be clear about that, and please vote no.
Representative Lucero.
Thank you, Madam Speaker. I'm just going to briefly stand in support of the Erdahl amendment. Representative Erdahl is seeking to transfer a sliver from those in the Minnesota sexual offender program to those that save lives. And Representative Liebling is very correct when she says we have to make choices, and here's our opportunity to make a choice, to transfer money from those, in many cases, take lives to those that save lives. Recently, there are 3 from this program that are moving to my community. One of them stabbed his wife to death and raped 2 teenage girls. Another one raped his 12-year-old niece and later admitted to molesting a 3-year-old girl. And another, 3 separate cases of forcing women into sexual acts while threatening them with weapons. So the choice before us is to take money from those who in some cases take lives and give it to those that are working to save our lives. Thank you.
Representative Mahoney.
Members, for those that have been around a while, I think I did a mic drop speech on PTSD for firefighters, police officers, EMS, and everything else. They are now all covered under workers' compensation. And yes, they are.
Seeing no further discussion, the clerk will take the roll. The clerk will close the roll. Seeing 53 yeas and 76 nays, the motion does not prevail and the amendment is not adopted. There is another amendment at the desk. The clerk will report the amendment.
Pearson moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A139.
To the author of the amendment, Representative Pearson.
Thank you, Madam Speaker and members. This amendment would fully eliminate TEFRA fees for Minnesota families that are on that program currently. The TEFRA program allows children with disabilities to access medical assistance with when their parents' income would otherwise make them ineligible. The bill takes a step in the right direction, and I appreciate that. They're reducing those fees by 15%. And I think this should go even further. We heard in committee, and I'm sure that we've all heard from people in our districts. I have friends who visit with me in the grocery stores and the athletic clubs, talking about how these fees can be too expensive, making their participation in the program impossible. If we totally eliminate the fees, we will help Minnesotans across the state access needed care. All it takes to fund our priorities, like ensuring children with disabilities can access care, is making tough decisions about where we should spend our money. So the amendment takes the funding from the increase in the bill for the sex offender program that is clearly far too valuable for the majority party. And I honestly think that it's going to be a difficult choice choosing between children with disabilities or the state's worst sex offenders. But seeing the outcome of the previous 2 proposals that would have used those dollars in other and better ways, I will withdraw the A139 amendment.
The A139 has been withdrawn. There is another amendment at the desk, and the clerk will report the amendment.
Gruenhagen moves to amend House File Number 2414, the first engrossment as amended, and the amendment is coded A133.
To the author of the amendment, Representative Gruenhagen.
Well, thank you, Madam Speaker. I believe this is the last amendment.
I believe you are right, Representative Gruenhagen.
Members, I think you're going to like this amendment. You know, we're dealing with the bill, HHS bill, that will raise health care costs and cut funding to nursing homes and has very little accountability on fraud. Here you have a chance, members, with this amendment, again, to take from the increase in the sex offender program and apply it to the shortfall in the nursing home reduction. Members, you know, we've been saying it's like a 68 or 70 million dollar state cut, and that's true. But if you add in the federal drawdown with that 68 or 70 million, it's actually a $200 million reduction to our nursing homes that take care of our most vulnerable members. I don't think that's the route we want to go. And, you know, members, when I look at the DFL budget of over a $3 billion tax increase, the extension of the sixth tax, and all the other things that you're spending money on, it's hard for me to understand why we're taking a position of reducing our nursing homes. Now, members, it undoes some of the reforms that we passed on a bipartisan basis and was signed by Governor Dayton in 2015. And I want to recognize Chair, or former Chair, Lead Schumacher for his work on that. He provided a lot of relief to nursing homes, and a lot of that money, which was billions of dollars over a period of years, has gone to increase wages and benefits for the workers. And they were in dire need, especially in my district and all across the state. So Representative Schumacher, I want to thank you for that work, and I want to thank Governor Dayton for also signing that bill. What this bill, what happens in this HHS bill is we're undoing a lot of those reforms, members. And I also have a handout there you could take a look at. But HF 2414, it also introduces geographic groupings to care-related to the care-related rate, which means nursing homes in different regions of the state have even different limits, even if they have the same quality scores. Because of this change, rural regions will once again have a lower limit than metro regions. Now, members, your side of the aisle, and especially the governor, ran on one Minnesota. It seems like another example of one metro Minnesota and we're being excluded or discriminated against as this current bill picks winners and losers. Keep in mind, members, that reimbursement payments to nursing homes are sometimes delayed up to 27 months after the costs are incurred. So the result is that this will be an immediate cut to funding, and we know how that's going to work because most nursing homes do not have a large reserve. And again, members, you know that they take care of some of the most vulnerable in the state. So we're taking money from the increase in the sex offender program to properly fund our nursing homes. To me, it's a simple choice. The other thing, members, HF 2414 with that geographic rating, it sets up winners and losers, okay? And I don't think any of us want that, regardless of what part of the state we're from. The other provision in the HHS bill that can negatively affect our nursing homes is some swing bed reforms, where it actually is less expensive in the nursing home to have a person in a nursing home setting to recover from major surgery or health care versus being kept in a hospital under a swing bed. And yet there's reforms that will incentivize more patients to stay in the hospital rather than move to a nursing home, further undercutting their reimbursement. Members, Madam Speaker, if Representative Wazalak, I believe in phonics, so I'm trying to use that. Wazawick would yield. Did I get that right? Okay. I'm open to being corrected, to tell you the truth. If she would yield. for a
Representative
question.
Wozniak will yield.
Okay. Representative Wozniak, help me out, boys and girls. Okay, are you aware that this change in the care-related cost cap alone will result in one of the nursing homes in your district, Certainty Care Center, receiving nearly a $700,000 a year less reimbursement?
Representative Wozniak.
Thank you, Madam Speaker. Thank you, Representative Gruenhagen, for the question. So I have 2 nursing homes in my district. One is Presbyterian Homes, and the other is Serenity Care Center, which Representative Gruenhagen referred to. And the 2 care centers actually have very different quality ratings. So Presbyterian Homes has a quality rating 10 points above the average quality score, and Serenity has a quality score 10 points below the average quality score, and it actually gets higher reimbursement rates even though it's lower quality. So what our bill is doing is making sure that we are incentivizing nursing homes to make sure that they are providing quality care for vulnerable folks in Minnesota, our seniors, and we're doing that by saying that, you know, if you provide quality care, we're going to give you a higher reimbursement rate. And I actually have numbers here that show that Serenity Care Center is going to be getting a 6.83% increase in their rates. So that's not something that I've heard, and that's not something that I'm concerned about.
Representative Gruenhagen.
Thank you, Madam Chair. Thanks for that response. Now, I know it's never happened up here at the Capitol before, but our number's slightly different, okay? But according to the information I have, there'll be about a $700,000 cut. Oh, by the way, Madam Speaker, could I have a roll call on this bill?
Representative Gruenhagen has requested a roll call. I'm not seeing 15 hands. Seeing 15 hands, there will be a roll call. Representative Gruenhagen.
Oh, thank you, Madam Speaker. Madam Speaker, would Representative Purcell yield for a question?
Representative Purcell will yield.
Representative Purcell, are you aware that this change in the HHS bill will result in Nielsen Place Nursing Home in Bemidji of seeing a cut of nearly $400,000 a year? And are you okay with that type of reduction?
Representative Purcell.
Thank you, Madam Speaker. Got some papers in front of me here too, Representative Gruenhagen. And can you tell me you're talking about direct care reimbursement or property reimbursement?
Representative Gruenhagen.
Oh, thank you, Madam Speaker. Representative Purcell, I think it's the combined reduction on both of $400,000.
Okay. Representative Purcell.
Thank you, Madam Speaker. And sorry I didn't ask you to yield, Representative Gruenhagen. I'll try and do better next time. My understanding, and as you said earlier, Representative Gruenhagen, we probably have different numbers we're dealing with here because I don't have what you have. I actually have an increase for Nielsen Place, 3.75 on direct care, an increase of 23.47% property reimbursement. So I understand that there's, under the quality rating that they're implementing in the HHS bill for nursing homes, that there is one nursing home in my district getting more of a better reimbursement rate than the other. But I'm not dissatisfied with the way they're implementing the quality care. So thank you.
Representative Gruenhagen.
Oh, thank you, Madam Speaker. Well, regardless of the number difference, keep in mind, members, we are reducing reimbursement to nursing homes across the state. And by dividing it up geographically, it's almost like we're setting it up to be taken over by large corporations or the government totally by geographic areas. And, you know, that's just a perception of mine. It almost seems that way. And then by reducing their rating, they're going to have to close or consolidate. And again, it'll be affecting the care of our most vulnerable. So members, I believe this is a good vote. There's plenty of money in the bill besides the increase to sex offenders to pay for this. There's $500,000 for a study on single payer. We know hardly anybody supports that. You can save that money and apply it to nursing homes. And there's other money that could could be applied to this. So members, please vote green on this amendment. Thank you, Madam Speaker.
Representative Erdahl.
Thank you, Madam Speaker. And actually, Representative Gruenhagen said quite a bit of what I was going to say, so this shouldn't take more than just a little bit. First of all, going back on the history of funding for nursing homes a little bit, used to be metro, rural, deep rural, three different rates across the state. Then that kind of blended into 2 rates or whatever. But I had to have a nursing home in Watkins, Minnesota, right on the Meeker County, Stearns County border. And the rate in Stearns County was much higher than Meeker County. Now, I know my son could literally take a baseball and throw it from the nursing home into the next district rate pane. And so we managed, with the help from Representative Schumacher and then Representative Abler, to get a change. The Watkins Hilltop Care Center was about ready to close. But because we got the rate changed, they expanded and are now one of the most highly rated nursing homes in Minnesota, doing very well. But now they are concerned again. I met in a nursing home in Cokato on Monday. They fear greatly the impact of this bill on them. The property, market value property, is certainly different across the state. In greater Minnesota, it's a lot lower than the metro area. And so they're going to get less money. And so we are, once again, looking at a disparity between greater Minnesota and the metro area in terms of how we fund our nursing homes. And keep in mind that these are some of the biggest employers in many of our small towns in Minnesota. So this is a crucial industry that we should not be fooling with, and we need to do the best we can, and this bill isn't doing it, to continue the fairness in funding.
Representative O'Driscoll. Representative O'Driscoll passes. Representative Considine.
Thank you, Madam Speaker. And I've just got to address the fact that the money does not go to the sex offenders. The money goes to the safety and security of the institutions. And by taking the money away, you are jeopardizing the safety of hundreds of rural greater Minnesota workers in Moose Lake and St. Peter. And that is irresponsible. Thank you.
Representative Robbins.
Thank you, Madam Speaker. I rise in support of the Erdahl amendment because, I'm sorry, Gruenhagen. I'm sorry. Because I'm not going to restate everything Representative Lucero said, but we share representing Dayton, and just in the last month, 3 level 3 sex offenders have been moved into our city. And I've met with Commissioner Lowry and the head of MSOP and talked about this. And this program of resettling these offenders is in shambles. And I appreciate that you want to increase the money in that program, and maybe that should be something we look at in the out years. But in my experience of having gone through this in our district, they are not ready to absorb this money because they do not have a plan for how they're handling putting these people in the different districts. And it's been a very frustrating experience. So rather than have immediate cuts to nursing homes, I think we should encourage and help the department to figure out an important strategy of how they're going to reintegrate offenders. I understand they're under the court order and they have to figure this out, but they're not ready to spend this increase, and this increase could be much better spent helping our nursing homes. And the nursing home piece also affects my district. I had a call yesterday from a man in my district who runs a nursing home facility, and he's so concerned about this. He brought the proposal, the bill, and all the numbers to his accountant, Clifton Larson Allen, and they ran the numbers, and his accountant said, if this passes, they need to prepare to shut down by the end of the calendar year. So this would close a facility because they just cannot afford this level of cut in my district. So I urge members to continue to work with DHS on improving the sex offender program. It needs it, but let's not cut the nursing home funding. Thank you.
Representative Haley.
Thank you, Madam Speaker and members. And I just want to share some actual numbers from my district. And these are communities of 2,000 people, 5,000 people. You'll be surprised at how these cuts add up. Red Wing Healthcare Community, over $400,000 in cuts. St. Crispin Living Community, over $1 million in cuts. The Gardens of Cannon Falls, $500,000. St. Elizabeth Healthcare, $1.5 million. Lake City Medical Center, again, a community of under 5,000 people, $1 million to their nursing home. It is unconscionable to me that in an omnibus bill that raises health care costs, doesn't address fraud, waste, and abuse, that we literally can sit here and call out that it's not a priority to fund our nursing homes. 60,000 Minnesotans turn 65 every year from now until 2030. This is not the time to reduce access to quality care close to home for our elderly folks. I am certain that in a bill this large, spending this much money, that this is a priority for Minnesotans, and I thought this was a priority that we all came in with when we started this session. I got a text today that I had visitors, and this wasn't on my calendar, and so I went to Capitol Room 316. There were 60 women from Goodhue waiting for me. 60 women that are over 65. And do you know what they told me? They said, Representative Haley, we want you to go into those chambers and tell them how mad we are about the nursing home cuts. 60 women from a town of about 400 people. This is important, folks, and the cuts are real. We need to improve this. Thank you, members, and thank you, Madam Speaker.
Representative Schultz.
Thank you, Madam Speaker and members. I'm not sure where you're getting those numbers from. So will Representative Gruenhagen please yield for a question?
He will yield.
Thank you, Madam Chair. Representative Gruenhagen, can you inform the body of where you're getting the data from about the cuts that you suggest are happening to nursing homes?
Representative Gruenhagen.
Oh, thank you, Madam Speaker. And yes, Representative Schultz. It's from the nursing homes we receive those numbers from.
Representative Schultz.
Thank you, Madam Speaker and Representative Gruenhagen. Well, I looked at those numbers that we were all getting from an association group, and their information is not accurate. Let me be very clear. We are not cutting funding to nursing homes in this bill. What we are doing is we are looking at improving the quality metrics because the quality metric that was being used, there was no incentive for nursing homes to improve quality. And what we are trying to do is provide the highest level of quality we can in our nursing facilities in this state. In 2015, the goal was to provide a reward to nursing homes who improved their quality by increasing their reimbursement rate. That did not work. This bill will provide higher reimbursement to nursing facilities that improve a new quality score that's going to be implemented. Nursing homes are going to get a minimum of a 5.2% increase. Their reimbursement rate, the rate of growth, may change, maybe a bit lower. And they're going to, and in the bill, we're reevaluating how we value property so it's more fair across all the nursing homes in our state. We're also improving the process of how we look at data on wages. And we're using not the geographic regions from the past that have been used, we're using the MSAs that will be updated each year to look at wages by geographic area so we know it's accurate, because we know they vary based on cost of living across the state. So what this bill does, again, is it evaluates reimbursement rates to make sure that we can provide incentives for nursing homes to improve their quality. So everyone in the state who has loved ones or themselves in nursing home can get the highest quality possible. And the data we have to look at what will happen to the reimbursement rates for nursing homes is from our agencies based on formulas that have been used in the past and the new formulas that are in this bill. We all care about improving the quality of nursing homes. We want the nursing homes to thrive in our state. We do. But the formula that was currently in law is not working to improve quality.
Representative Doubt.
Thank you, Madam Speaker, and thank you, Representative Schultz. I think and believe that you think you're doing the right thing here, but I'll call your attention to your spreadsheet on this bill. You are cutting nursing homes $68 million, period. You don't get to stand on this floor and say that you are not. Line 1, gotta have the glasses. Line 126. In the next biennium, you're cutting them $12 million, and in the tails, a little over $56 million. That is a direct cut to nursing homes of $68 million, period. And it's in your spreadsheet that I'm getting this. I assume you got that from the agencies. That is a direct cut to nursing homes. There is no way to define this as something else. You can talk about quality, you can talk about whatever you want, but in your spreadsheet, it says that you're cutting nursing homes $68 million over the next 4 years. And while that's a spreadsheet and it might not sound like much, it means that nursing homes in this state will close if this bill becomes law. And I'm sorry that you don't trust the information that nursing homes are sending to their members, but if it's all right with you, I'm going to trust that. And I have a little trouble trusting you when you just told us there was no cut to nursing homes in this bill. And I look in your spreadsheet on this bill, and it says as clear as day that there is a cut to nursing homes of $68 million. So if there's one thing that we need to be in this chamber, it's honest. And I'm not sure if you misread the spreadsheet or if what's going on. But it's absolutely as clear as day on line 126 of your spreadsheet that you're cutting nursing homes $68 million over the next 4 years. And that's a fact. You can explain it away with quality stuff, and we understand what you're doing. You're changing the curve, and you're going to say that you're rewarding nursing homes, and they're actually going to get more money if they're really a great performing nursing home, and they're going to get less if they're a low performing nursing home. But the bottom line is, all nursing homes, together as one group, all nursing homes will receive $68 million less under this bill. It's in your spreadsheet, and it is a fact. And if it's not a fact, then your spreadsheet is wrong and you've given us wrong information. And that should be corrected before we send this bill out of this chamber. But I think we all know it's true. And it's not the first time we've heard it today. This bill, and for those watching at home, for the folks that take care of our loved ones who took time out of their day to come here and be in the hallway today and pull members off the floor and tell them, the devastating stories of what will happen if this bill becomes law. It's disrespectful for us to say that there are not cuts to nursing homes in this bill. And don't talk about reducing the increase or whatever. I can read the spreadsheet. This is a $68 million cut to nursing homes, period. No ifs, ands, or buts about it. That's what the spreadsheet says. And I think we owe it to those folks that care so dearly for our loved ones and try to do the best job that they can to make sure that they're caring for our loved ones. I tell you what, it's one of the proudest things that one of the things that I'm most proud about that we accomplished during my tenure as Speaker in this chamber was changing the way we reimburse our nursing homes, covering the costs of actually caring for our loved ones, and allowing them. And I traveled all over the state visiting nursing homes, hearing the stories about what and we didn't put strings on it. We let them spend the money and invest the money how they needed to do that to care for folks that our loved ones in those nursing homes. If I were to say what's the thing I'm most proud of in my 4 years as Speaker of the House, it's this provision. That we were able to put hundreds of millions of dollars of additional money into nursing homes to improve the quality of care, so that they could reimburse pay employees at a higher wage, so we didn't have turnover, so that we had better quality of care in those nursing homes. And I'm heartbroken to see, first I'm heartbroken to see that you're doing it. And second, I'm really heartbroken to see that you're trying to explain it away. This is a $68 million cut to nursing homes, period. I didn't plan to stand up and speak on this. I've been trying to get everybody to hurry up so we could get done with this. But this was so egregious, I can't allow somebody on that side of the aisle to stand up and say that you are not cutting nursing homes. And members, before you press your buttons on this bill, I don't know what they've told you, if they've told you that, well, the high quality ones are going to get an increase and the low quality ones are going to decrease. That's probably true. But overall, there is a decrease across the board of $68 million over the next 4 years. It's in your spreadsheets, not just for you, Representative Schultz, but all members. Pull it out. You don't believe me? Got to put the glasses on. Line 126, almost $12 million in the first biennium, and a little over $56 million in the second biennium. That's a little over $68 million direct cut to nursing homes and nursing care and the care for our loved ones over the next 4 years. So please, I would, and I'll just give you some advice, I would check with your nursing homes before you push your button today. Because I'll bet you dollars to donuts, many of you and many of the nursing homes in your districts, if you press a green button in support of this bill, you are going to vote to cut money to your nursing homes. And you can say that you don't trust what the nursing homes are saying, but you put that aside. Look at your own spreadsheet on this bill. This is a $68 million cut to nursing homes, period. That can't be explained away. So members, just be informed before you push your button. And I tell you what, we had a situation on this House floor 2013 where we had a member that brought a bill about hospital funding and didn't really understand. And we were on that amendment for 3 hours, and nobody knew what the impact to their hospital was going to be. And members were leaving the chambers, calling their hospital administrators, trying to figure out what's going to happen to my local hospital. This is as serious as that. I wouldn't take a vote in this chamber to cut nursing homes at a time when we have $1 billion surplus in our budget, when you're raising $12 billion of new taxes over the next 4 years. Think about that. Staggering. $12 billion of taxes over the next 4 years in your proposals. Add it all up. That's how much money you're collecting, additional money you're going to collect from Minnesotans. And we've got $1 billion surplus on top of that in the next biennium. That's $13 billion. And our most vulnerable, our loved ones who are the most vulnerable, who rely on these services, you're going to vote to cut them $68 million. And that's a fact. Know it and check with your nursing homes before you press your button. This is the real deal. I can't in good conscience do something like that. And my guess is you probably can't either. And don't let your leadership or your chairs try to explain it away. This is a direct cut to nursing homes of $68 million.
Representative Schultz.
Thank you, Madam Chair and members. Representative Dowd, every member in our caucus has received the changes to their nursing home reimbursement levels. I want to thank our staff member, Chris McCall, for working hard to get that information to all of our members. And we can probably get you that accurate information as well. I don't appreciate the insinuation that I don't understand math. I do. And this is the difference. We are changing the growth rate in reimbursement levels. All the nursing homes will get an increase based on their projection. So instead of going this rate, it just tweaks the slope of that growth rate in nursing homes, but they're going up. They're going up. Nursing home reimbursement rates are increasing. That is, Representative Dow is talking about the forecasted change, that it is going to change. So the expectation for nursing homes should change because they're not meeting those quality metrics. But they're all getting higher levels of reimbursement over time. So you can't just look at the forecast in the future and say they're going to get a cut next year, because they're not. So I do understand the information. Our members understand what is going to happen to all their nursing homes in their district. They are very well informed and will take a green vote. And a red vote on the amendment and a green vote on the omnibus bill, so we can improve the quality in our nursing homes.
Representative Keel.
Thank you, Madam Speaker. I'm going to disagree with Chair Schultz. I had in my office one of my administrators for my nursing homes, and I've since contacted a few of them. They're very concerned. I had one in there that was in my office that was in tears, very upset. She's an administrator I can find on the weekends at nights, because if someone doesn't show up or get sick, she's filling in. She does whatever's needed whenever it's needed. I've heard insinuation somewhere along the session that nursing homes they did not put the money toward their staff. This is what one of my nursing homes that's 95% full, very successful, and is the largest employer in this small community. The maintenance said we were able to upgrade more electric beds and purchase some new furniture for the residents' rooms. A dietary aide said we could finally update our overall appearance on our nursing homes and install automatic doors in front entrances. The office manager said we're able to finally give health insurance to families, the staff. A resident member said my mother considers her private room her own apartment. It has improved her mental well-being. HR told me we're able to increase the entire wage scale. Work morale increased. Activities said, and I want to point this out, they replaced their tub for the residents. Members, there are a lot of people in their homes that go in and rent time in their tub because they aren't able to bathe in their own homes because of their health. So they go into our nursing homes in rural areas to use that facility. The cook said, we're able to get new stainless steel counters on our kitchens, countertops for our kitchens, which have not been updated since '72. And the final comment from a nurse's aide, we were able to purchase another mechanical lift for the resident transfers so we don't have to share with another wing. Members, if you've ever worked in a nursing home, if you have to wait for a lift, it is not good for the person who needs that lift immediately. And our nursing homes are really struggling. Remember, we have a $1 billion surplus. These changes, these cuts are inexcusable. This is not the way this should be. We have worked hard to make sure that our nursing homes have been successful. The nursing home directors that I've talked to have said they're finally going to see their budgets in black. The director I talked to, the administrator I just talked to that I said was in tears, she said, we're going to be in the black. I said, well, what happens with this cut? And I asked her to check out all of the detail. Don't just give me the number you think is going to be. Please check it out. So she said, okay, I'll get back to you. This is what she told me. I would like to see the system left alone, as it costs the state less today than originally budgeted. We get paid for quality, and if we do well, we get paid well. If we do not do well and follow the guidelines, we get less. So they're considering the quality. She tells me that in 2020, she will see a $40,000 cut. In 2021, she will see an $86,000 cut. And she will see, now this is a small nursing home, folks. She will see a $130,000 cut in 22, and by 23, it will be over $200,000. This is an administrator that's trying desperately to replace the roof. Again, they are one of the larger employers in this small community, and if they are not there, their loved ones are going to be hours away because we just don't have that possibility. It is very important to our families and for our seniors in a very highly aging district that these cuts cannot happen. We need to make this a priority. I hope you look at those numbers again, and I hope you review it, because if this bill continues as it is, the cuts for there will be cuts for funding in nursing homes, and I'm very disappointed to see this. Thank you, Madam Chair.
Representative Dowd.
Thank you, Madam Speaker. I don't really need to speak on this, but I do want you to know I took the spreadsheet, I circled the numbers, made a copy of that page, and it's on its way out. So if you want to wait to see the spreadsheet before you vote, it's on its way out to you. If there's a chance it's going to change your vote on this, you can wait for it and you can see that spreadsheet. And if you can read a spreadsheet, you will see that this is a little more than $68 million cut in nursing homes over the next 4 years. And there's no, I mean, the spreadsheet shows it just as clear as day. And so it's on its way out. If you want to wait for it, it's on its way out, but I'm not going to delay this any longer. I don't have it in front of me. I think it's 126. I've circled it on the spreadsheet, so it's on its way out to you.
Representative Schultz.
Thank you, Madam Chair. Members, just please vote red, no on the amendment.
Seeing no further discussion, the clerk will take the roll. We're good. The clerk will close the roll. Lean votes aye. With 56 yeas and 73 nays, the motion does not prevail and the amendment is not adopted. There are no further amendments at the desk, and the clerk will give the bill its third reading.
Third reading, House File Number 2414, as amended.
Third reading. Discussion to the bill. Representative Howard.
Members, thank you for a long debate, and I just want to speak briefly to an important provision that I've worked on in this bill, that many members have worked on this bill, and that deals with the affordability of insulin. Hundreds of thousands of Minnesotans are part of our diabetic community in Minnesota, and we have a crisis in this state, and it's the affordability of insulin. A single vial of insulin that cost about $20 in 2001 now costs about $300. This has resulted in Minnesotans going on GoFundMe sites asking for help to afford their insulin. And studies show that 1 in 4 Minnesotans or Americans are rationing their insulin, which has had deadly consequences. And that brings me to the story of Alex Smith. Many of you have heard Alex's story this session. James and Nicole have shared the story of their son, who was diagnosed with type 1 diabetes at 24 years of age. And when he turned 26, he came off his parents' health insurance. Now, Alec had a full-time job as a manager at a restaurant in Richfield, and so he didn't qualify for public health programs, but he also couldn't afford the crushing cost of his insulin. He needed $1,300 a month to afford his insulin, and so he began rationing his insulin. And a month later, he was gone. On June 27th, 2017, Alec's mother, Nicole, received the call that no parent should ever receive, that her son, Alec, was found unresponsive in his apartment. His death was caused by diabetic ketoacidosis, which occurs when diabetics are starved of insulin. When Alec died, he had $1,000 in his bank account. $1,000. He was waiting for his next payday to be able to afford the insulin he needed to survive.
Members, please take your conversations off the House floor and into the retiring room. Thank you. Representative Howard.
Thank you, Madam Speaker. Alec should still be with us. It is heartbreaking, it is infuriating, and it should never, ever, ever happen again. And that is what the Alec Smith Emergency Insulin Act will do in Minnesota. It will say that never again should a Minnesotan lose their life because they cannot afford the insulin they need to survive. We're providing short-term, affordable relief to Minnesotans like Alec that can't afford the crushing cost of their insulin. That's their lifeblood. They need it to survive. And we're paying for this new program by asking the large, big three insulin manufacturers that control the entire market to share in solving a crisis that they helped create. Just one of the insulin manufacturers, the big three, had revenues of $25 billion last year and profits of over $600 million. And according to the Institute of Tax and Economic Policy, the effective federal tax rate of this company last year, $0. It is time for our large pharmaceutical companies to have a stake in the solution of making prescription drugs more affordable. And that's what this will do for insulin in Minnesota. And in wrapping up, I need to thank the type 1 diabetic community of Minnesota that has been here at this Capitol countless times, sharing their stories and advocating for change. They are changing the conversation in Minnesota and across this country in a meaningful way. And lastly, I absolutely need to thank Nicole and James for sharing their son's story. I am in awe of their courage and relentless advocacy, and to share the worst moment of their life and to share it over and over and over again in the hopes of something coming of it. And it is absolutely heroic. And we are so sorry that we were not able to save Alec, but because of Nicole, because of James, Alec is going to save the lives of Minnesotans. And I'm eternally grateful. Thank you, Madam Speaker.
Representative Stanstead.
Thank you, Madam Speaker. Members, we have the decision before us to support this bill or not. And this is not a perfect bill, in my opinion. There are some provisions that are deeply troubling to me in this bill. One of them we really haven't had a full discussion on, and that's the positive alternatives cut that is in this bill. This is a 25% cut to a program that truly benefits women and truly supports choice. This is a program that is not about abortion. It is a program that aids young families and new mothers in supporting their choice to see their pregnancy through to term. This cut will be $1.7 million a year to a program that did not have a bill introduced and did not have a hearing. With that being said, I think there are many wonderful provisions in this bill. It's not the way I want it to be in totality, but I will be supporting this bill today. I am grateful to the work of our committee members on both sides of the aisle in putting this bill together. And I ask, as this bill goes into conference, if you are chosen to be part of this committee, this conference committee, that you will earnestly consider reinstating the funding and fleshing out and debating this cut. And I thank you for your support.
Representative Tice.
Thank you, Madam Chair. Thank you, Madam Speaker. We spent most of today talking about this bill. We talked about how it's going to raise health care costs and cut funding to nursing homes, allow fraud to continue, and we're also talking about cutting the PAG, the Positive Alternatives Grant, which is very important to my community. Before I got here, in fact, I was president of Birthline, and we relied a lot on the Positive Alternative Grants. What the Positive Alternative Grants did, it gave women who were coming into the Pregnancy Crisis Center, not sure what they were doing, trying to make a decision, and of course there's several different decisions they could go through. They have a program called Stepping Stones, and what Stepping Stones is it's a little course, and if the father is present and wants to, then he can be a part of it as well. But they go through a little training course about what the choices they think they're going to make are going to be about. Give them a little background of how this can make a difference in their life. When they complete certain units, they get money, fake money. But what they can do with that fake money is they can go to the store and buy whatever they want. They can buy diapers, they can buy clothes, they can buy baby furniture if they decide they want to parent the child. If they don't, if they're going to do an adoption plan, then they can buy personal items like shampoo, face washes. They can get gift cards to different stores to get gasoline, that type of thing. It just really helps them figure out what they want to do. And if they decide that they want to make an adoption plan, or if they decide that they want to parent afterwards, after the baby comes, then there is some support for them there as well. They're welcome there anytime. And if someone did decide they had an abortion plan, they would not help with having the abortion, but they would say, hey, we're here if you need help afterwards. No questions asked. We're here for everybody. Our love isn't just for certain folks. So taking away any funding from the PAG grant is taking away a lifeline for many young people trying to make their decisions. And you know what? I shouldn't say young people. When we think of crisis pregnancy centers, we probably think of more high school kids or college kids. No. The women who come there start at age 12 and 13, but they go as high as 40-something. This is not just for one group. This is for women. This is really bad for women. And it's also bad for men who support them, who are staying in their lives and helping them. It just breaks my heart. One year, it was decided that they were going to allow other agencies to apply for the PAG grant. And it backed that grant up for about a month. Nobody new applied, but they wanted to have it available for that. That was devastating. It was devastating to not get that grant on time. It closed down, basically, Birthline for about a month. The executive director took a month vacation just so that they could keep the place open. This grant is very important to the women of Minnesota. I don't care what decision you want to make, it is important to the women of Minnesota. And taking away any funding is absolutely, I can't even think of the word to describe it. It is so wrong. And it makes me so angry that we would do that. What also makes me angry is that we're not entertaining some of the pro-life bills that we bring forward here. People will say, why do you bring this forward? You know it's not going to happen. You know why? Because we value life. Because it's that important to me and every other one of us here on this side. It is that important. This year, and I think it was March 18th, on this floor, I heard a statement that I will never forget. And that statement was, if you save one life, you save the world. We weren't talking about abortion. But by gosh, did that ever resonate with me? You save one life. And this is why I stand here and I tell you it is not right to do abortion after 20 weeks. It's not right that we don't let women see the ultrasound. It's not right when there's a heartbeat that we don't give more reverence to that. If we save one life, we save the world. I will never forget that. Never. And yes, at 17, I could have made a decision different than what I did. I made an adoption plan. And I thank God every single day that I did that. It was hard to do. I didn't want to go through hurting my mom and dad. I didn't want to do any of that. I just wanted the pregnancy to go away. But now guess what? I have 2 grandchildren with a third on the way. And I look at this young man who's older than I want to say. I look in his face and I see me. I see my husband. And we had 2 sons after we had Rob. And they are so the same, you can't even believe it. They didn't grow up with each other. They didn't meet until Rob was 18. But by gosh, it is just absolutely a gift every single day. I thank God for it. And these are the reasons why I won't vote for this bill. And then if I needed more ammunition, I looked at the runs that we got from our nursing homes, and we're going to lose over $4 million in Stearns County. I looked at the nursing homes in Melrose, Albany, Sauk Center, Glenwood, Belgrade, Painesville, Cold Spring, Sartell, Sauk Rapids, Waite Park, St. Cloud, and St. Cloud, which one is St. Benedict's and one's Talahi, and we are losing over $4 million. How do we expect nursing homes to have better care and get their incentives when they don't have the money to do it in the first place? We worked our buns off to get that financing, and it was such a great accomplishment, and it was a battle every single day. And now we wonder, we're going to make more rules on care because there's been issues in care, but we aren't giving that funding. I'm looking at one of them, and I'm thinking they're not high on the list of good care because they're going to lose $364,883. That's a lot of money for a small nursing home. That's a small nursing home in Waite Park in my district. Now, how are they supposed to get up to the numbers that they want to be? How are they supposed to get up to a better level when they don't have the money to hire the folks? And how are we going to have folks come into the industry if they're not going to get paid better? I understand an incentive system, but you're looking at a group of folks, nursing homes, who are struggling. We've known they've been struggling for a long time. And when the bill passed and they got the funding they needed, they were so grateful that finally they were going to be able to run a little bit safer. They were going to be able to do the things that they could do. You heard Representative Keel. Yeah, I'm Tice, I'm not Keel. You heard her talk about what they can do with the money that they have, and yet we're going to cut. It's hard to vote for a bill when I look at the numbers and over $4 million in Stearns County is going to get cut in my nursing homes. There's no way I can do this. I'm going to be voting red.
Representative Albright.
Thank you, Madam Speaker. First, Representative Liebling, thank you. Thank you for having the courage to put a bill of this nature together. It's not easy. And while I didn't sit on your committee this year, I do appreciate and respect the hard work that your staff put together. This biennium I serve on health policy with Chair Moran. And we took up some pretty tough issues. But we worked collaboratively on those. And I think we made some strides in personal areas, or in areas that affect Minnesotans. But there are some undeniable truths about this bill this year. You are raising the cost of health care. You are cutting funding to nursing homes. And you haven't adequately addressed the fraud that is rampant in DHS. On the balance, I will give you credit for a few things. You did establish some new regulations surrounding CCAP. Tip the hat to Representative Pinto and his committee. You do restore the 7% cut to DWRS. You're also reducing fees for some parents in terms of enrolling them on MA through the TEFRA. And most notably, in some sectors, you're changing and adding to the requirements for PBMs, which I think is overdue. But on the balance, I find exception with some of the things that are in the bill. You're increasing funding for CCAP at a time when the OLA has provided 2 reports that call into question the usage of those funds and the fraud that is apparent. Unfortunately, the administration that just took office in January, the best that they can do is they can call for sensitivity training. I think most folks in Minnesota aren't looking for more training. They're looking for justice. We've been entrusted with an incredible responsibility. And the folks in Minnesota right now are questioning whether or not that fiduciary responsibility is being upheld. There are provisions in this bill that allow dangerous criminals to work with Minnesota's most vulnerable. Let me repeat that. You're allowing dangerous criminals to work with those amongst us that are the most vulnerable. In Scott County, we have a number of mandates that we have to cover. And I note in the bill that you're shifting the cost for provisionally discharged sex offenders to counties. Counties can't bear any more of those mandates. They're having tough time enough just to try and cover everything the state is requiring of them. You're cutting $68 million from nursing homes. Members, you're raising the cost of health care. You're cutting funding for nursing homes. And you're not addressing the rampant fraud. You're bringing back the provider tax. This is after campaigning on lowering health care costs. You're using the health care access fund as if it's this whitewash across all the problems that you should be addressing. For the last 4 years, we've tried to address the inefficiencies and the fraud that are rampant in our healthcare system. And what you want to do? You want to repeal the sunset so that you can continue to kick the can down the road and not address the issues underlying some of the most prevalent problems in our healthcare system. I have a friend who used to own a durable medical device company. I say used to, because he couldn't afford the reimbursement rates from the state. Representative Liebling, you have provisions on page 604 and 605 in this bill that talk about a unified healthcare system. They've never been heard in committee. The first time that they were heard was in the DE that you put before your committee. And if that weren't enough, now we're going to allow the Attorney General to be the drug pricing czar for the state. We're putting a tax on insulin manufacturers. When insulin manufacturers of their own ability have free programs that are available to those people. And as has been said, we're taking money away from positive alternatives, a program that helps women who are facing pregnancy. If that isn't an endorsement for some of the programs and the provisions that you advise to, I don't know what it is. You're prohibiting for-profit insurers. You're going to quash competition and decrease innovation. For these issues, members, and many, many more, let me just remind you of what this bill does do. It raises your health care costs, it cuts funding for nursing homes, and it allows the continuation of rampant fraud. Please vote red.
The member from Blue Earth, Representative Considine.
Thank you, Madam Chair. Each of the last 3 years, on the last day of the session, I have gotten up and railed about the wages of personal care attendants and home health aides. I believe at one point 2 years ago, Representative Garofalo was blocking my emails as I sent out an email a day for 2.5 months talking about this. Last year, 3 different times I brought this to the HHS Finance Committee. I am pleased to say that Chair Liebling has assured me that there is a provision in the bill for raising the salaries of personal care attendants and home health aides in Greater Minnesota, who are currently at $11 an hour. Not sure I exactly understand it. I was going to ask her to yield for a question so she could explain that, but this has gone on long enough. But it was the #1 thing that I campaigned on and told people it was my #1 priority, and that is why I felt the need to get up and discuss it. I'm looking forward to seeing how this works out. If August 1st rolls around and you are seeing these increases in your salary, I hope everybody will send Representative Liebling a postcard thanking her for doing so. And if you haven't, send me one, and I am sure that Representative Liebling and myself will continue to fight this injustice. Thank you.
Representative Heinzelman.
Thank you, Madam Speaker. I'm going to bring attention to a provision in the bill relative to CCAP that was discussed in committee and was a surprise to me, members. So you have these folks that we know, and we've debated who they are and who they may not be, but there are those that we know have submitted false information to counties, and one of the frustrating provisions that we found and that I highlighted, discussed, was an establishment of a process for those that have admitted to fraud, and the section in statute is 119B.125, subdivision 6, I think is the correct one. And I hope people understand what this is doing and the impact that it could have going forward. And during the public hearing on House File 1, when we raised concerns and objections to these provisions, the bill author, Rep. Katiza-Watun, claimed that these provisions were required for compliance with federal law. When I pressed further on the assertion that this language is required, the Department of Human Services admitted that these provisions are not required. Yet here they are in the bill. I just want folks to be aware of that before they vote on this bill. I think it's important that we understand that we are allowing people that have, like I said, admitted to intentionally giving their county materially false information on the provider's billing forms a process to be paid and to continue to offer services in Minnesota. Thank you.
Representative Franson.
Thank you, Madam Speaker and members. To the public, I am holding in my hands the Health and Human Services Omnibus Bill. It's 1,130 pages and weighs 12 pounds. This 1,130-page, 12-pound omnibus bill will raise health care costs. It will cut funding for nursing homes and will allow rampant fraud to continue in the child care assistance program. Is this the clown world? Is this where up is down and down is up? Time and time again, I heard on the campaign trail from Democrats running for office that omnibus bills are bad. Each bill must stand on its own and not be stuck in an omnibus bill. Divisive policy bills must not be put onto budget bills, but here we are today, discussing the Health and Human Services Omnibus Bill. We have heard many times that a budget is a moral document. Then why did the Democrats create a 12-pound omnibus bill that raises the cost of health care? Does that sound moral to you? This bill cuts funding to nursing homes, a $68 million cut. And then when you factor in the federal match and private pay, it's a $200 million cut. I've been texting with my nursing home administrator. Indeed, there is a cut. Does that sound moral to you? This bill also cuts funding to positive alternatives. To the public who may be wondering what the Positive Alternatives is, it's a program that supports, encourages, and assists women to carry their pregnancies to term by offering local resources and supportive assistance during pregnancy and beyond. Why would Democrats want to cut this program? Does that sound moral to you? Taxing sick people, cutting nursing homes, cutting programs to pregnant women, is that moral? And then members, when the Office of the Legislative Auditor report was released, we learned that the child care assistance program fraud is real, pervasive, and more severe than the agency has been willing to admit. We also learned that we had long suspected that the fraud is not limited to just fraudulent billing or employment scams, but includes a failure to provide the services required. Under the previous DFL administration and continuing in the current administration, the table was set for fraud. And while there were some efforts in this bill to reset that table, this bill still falls short of what is needed to take the scope of fraud seriously. In this bill, 1,130 pages. This bill establishes criminal penalties for fraud, but it does not give the prosecutors the tools they need to prove intent to commit fraud, which is necessary for those penalties to ever apply. It is an honor, though, and has been an honor to serve on the Early Childhood Division, but I regret to say that the division never took seriously its oversight responsibilities. Our division held 19 meetings before hearing from anyone in a position of authority from the department to speak to or answer questions about the scope of child care fraud. In fact, efforts by the Republican minority were blocked when we wanted to subpoena the Inspector General, Carolyn Ham. And within days of those efforts, Ms. Ham was placed on investigative leave. Additionally, the chair of the Early Childhood Division confirmed he did not even request her appearance before the division. The efforts, though, by the DFL majority to protect the bureaucrats who have been mismanaged the Child Care Assistance Program and the Fraud Investigations Unit should be raising its own questions with taxpayers and serious investigative journalists. This bill dumps millions of new taxpayer dollars in a fraud-riddled program. This bill had a chance to do what was best for children and its parents, as well as the hard-working, honest providers whose reputations are jeopardized when the entire program remains in question. Instead, this bill, 1,130 pages, 12 pounds, misses the mark and puts the interest of fraudulent providers and recipients ahead of honest, hardworking families and their children. I want to thank the chairs and the staff for their work in putting together this bill, a bill that does raise the cost of health care, that does cut funding for nursing home, certainly allows rampant fraud to continue in the child care assistance program. But today, members, this is a bill I cannot support. Thank you.
Representative Lucero.
Thank you, Madam Speaker. This bill raises health care costs, cuts funding for nursing homes, and allows rampant fraud to continue. What was that, Representative Lucero? Did you say that this bill raises health care costs, cuts funding for nursing homes, and allows rampant fraud to continue? Madam Speaker, yes, that's exactly what I said. This bill raises health care costs, cuts funding for nursing homes, and allows rampant fraud in our welfare programs to continue. But Representative Lucero, I thought Democrats cared about nursing homes. No, Madam Speaker, this bill cuts funding for nursing homes. But Representative Lucero, I thought Democrats wanted to lower our health care costs. No, this bill raises our health care costs. But Representative Lucero, there was an audit confirming rampant fraud in welfare programs, and that Democrats wanted to help fix that. No, this bill allows the rampant fraud to continue. Madam Speaker, Representative Winkler, if you can see it from there, I have my tabbed copy here.
They match your suit.
Yeah, thank you, yes. But I have my tabbed copy here of the 1,100-page bill, so we can begin to go through it. We could, but it won't change the fact that this bill raises health care costs, cuts funding for nursing homes, and allows rampant fraud in our welfare programs to continue. So, Madam Speaker and members, we can do better, we should do better, and this 1,100-page, 12-pound bill needs to be voted down because we do not want to raise health care costs, we do not want to cut funding for nursing homes, and we do not want to allow the rampant fraud in our welfare programs to continue. Thank you, Madam Speaker.
Representative Quam.
Thank you, Madam Speaker. Members, I feel bad. This is the first time that I've been a member of this body, and I wasn't and am I not on one of the HHS committees, not there to try and fight in the committee work to make this bill better. I heard a lot of amendments to try and take care of issues. I'm not standing up here because of that. I'm standing up here because I promised multiple people, constituents and others in my counties and in the area that I've met and worked with over the years to try and make things better. And frankly, I have multiple emails on the fact that this is going to cut nursing homes. I know over the years, we've had many nursing homes close. The one that I visited my great-grandfather in Kenyon was in dire financial straits. And I promised them I would carry their message to the floor. And the message is, we can't accept these cuts to the nursing homes. We've heard 68 million. That's the tip of the iceberg. There's federal matching and other money. It's much greater than that. And I don't know about you, but the nursing homes aren't just a large employer. They're the heart of many of these communities, because that's where their families, their teacher that they had when they're in school, their neighbors, etc., are in as a community, still with them. They visit. They do not lose that connectivity. They don't lose that knowledge that they get when they go and talk to them. They want, assisted, overregulation of assisted living. They've got issues with the swing beds. But a lot of the administrators are saying, why aren't you taking care of the fraud, waste, and abuse so we'd have the money to where we could fund what needs it? And frankly, that's so disappointing. Whether it's the MNsure, CCAP, HMOs, we have multiple cases of legislative auditor reports and other reports of fraud, waste, and abuse. This bill does not fix that. It doesn't address the repetitive issues we have. And when you bleed off a couple $100 million here, $100 million there, tens of million here, you add them all up and think of what you can do. I remember sitting in committee when we had a little bit of money left over. And we talked about 2-3 dozen different things we could spend it on. If we had 500 million or $1 billion more, so many great things we could have done. We tried it with amendments to fix it, to improve it. And that's what people told me to come here. This bill does not take care of moving Minnesota forward and doing a better job. This bill rehashes, as it was put, they're going back to formulas used in the past for the nursing homes. That's the reason why we had them closing. We worked together, and bipartisanly, the governor signed it, and we were making ground. This bill takes that away. We go backwards. We're cutting funding for the nursing homes in our communities, and that is wrong. Now, there's too much to talk about for all the shortcomings of this bill, but I want you to know that I'm not speaking for myself. I'm speaking for all the people that came to me with their issues and said, we want this spoken on the House floor. And I am their servant bringing their message. Please don't support this bill.
The Minority Leader, Representative Dowd.
All right, thank you, Madam Speaker. When the Minority Leader speaks, it means we're almost done. So, we've had a very spirited, long debate here about the important provisions in this bill, and I've got a few comments about that. But I want to remind folks of the promises they made last fall on the campaign trail. All of the folks that you said that you wouldn't raise their health care costs, that you were going to work here in St. Paul to reduce health care costs. And today you're breaking those promises. Democrats, you ran against reinsurance, even though some of you voted for it this year, and you called it a giveaway to insurance companies. And what are you doing today? You're raising health care costs on Minnesota families by $2.5 billion over the next 4 years. You're continuing the immoral practice of making illness a taxable event. And you're passing a premium subsidy plan that literally involves cutting checks to insurance companies. And I wonder if you're proud of what you're doing today. Think back to what you said on the campaign trail. This bill is laughable. And this bill, which I've got printed out here on my desk, you'll notice as we work through the week here, this pile is going to grow. I've got all 3 bills now here, and I'm going to add each one. So you can see, and folks can see at home, how big these bills are. This bill, the largest one ever passed in the state of Minnesota, over 1,100 pages. And this bill comes from a caucus who couldn't complain enough last year about a bill that was 200 pages shorter than this one. This bill will raise health care costs for Minnesotans, it will cut funding for nursing homes, and it will allow rampant fraud to continue in our public programs. And this bill will increase health care costs for every Minnesotan on every procedure by 2%. You're ending the reinsurance program that has proven to lower health care costs, health insurance costs. It's a program that was so successful it's been held up as a national model. And it's been adopted in other states, red and blue alike. And what are you replacing it with? You're replacing it with a subsidy program that will help fewer people, it will cost more than reinsurance, and it won't stop health care costs from skyrocketing next year. Let me repeat that. The subsidy program will help fewer people. It only helps the people who don't get a premium tax credit and only helps those who shop in MNsure. So if you get a tax credit or if you shop off the exchange, you're out of luck. This program costs more money. Your bill cancels $393 million that was paid for 2 years ago for 4 years of reinsurance, and it replaces it with $475 million for the premium subsidy. And finally, your bill will do nothing to prevent rates from skyrocketing. If rates shoot up 50%, I want you to look your constituents and Minnesotans in the eye and tell them that the 20% subsidy is a great deal. I can't think of something that's more nonsense than that. With a $1 billion budget surplus, this bill is going to slash funding for nursing homes by $68 million. I hope you called your nursing home directors. Our members have administrators in tears because of what your bill will do to their futures. And you ought to be ashamed of yourselves for putting that in this bill. Nursing homes provide care for our loved ones. You wave your hands and say these aren't cuts. I want you to tell that to the seniors whose care will suffer because their nursing home facilities will lose hundreds of thousands of dollars in funding. And finally, your bill allows rampant fraud in our public programs to continue. And you can stick your head in the sand and pretend like it isn't happening. Our legislative auditor has produced report after report detailing hundreds and hundreds of millions of dollars in fraud. And what do Democrats do? They question the OLA's methodology. They call it fairy dust. You say that people who are genuinely concerned about millions of dollars in fraud, pervasive fraud, according to the OLA, you call those people racist. All session long, you've refused to hold hearings on the OLA report, despite saying that you would once the second one came out. You refused to hold hearings on the great bills brought forward by Representatives Franson, Representative Zerwas, Representative Heinzman, Representative Demuth, Representative Albright, and many others. You've ignored the biggest recommendation in the OLA report to make the Inspector General an independent agency. And in fact, your bill, part of Representative Katiza Watoon's House File 1 originally, provides the right to an administrative review if someone admits to giving material false information on billing forms or attendance records. I really wish I was making that up. You think that people who admit to ripping off Minnesota taxpayers should get an extra review, and that review should be paid for by the taxpayers. That's your punishment. Your bill comes up woefully short and will allow rampant fraud in our programs to continue. And at the same time, when you won't make sure that we're using the tax dollars wisely, effectively, and efficiently, you want to go right back to the well and increase taxes on Minnesotans by $12 billion over the next 4 years. That's your plan. So in closing, members, today you're passing the largest omnibus bill in state history, the largest one ever. It's a bill that raises health care costs on Minnesota families, a massive broken promise to your constituents that you made over and over again last fall when you asked for their trust and for their vote. This bill cuts funding for nursing homes at a time when Minnesota has a $1 billion budget surplus, and when you're raising $12 billion in additional taxes over the next 4 years. You're cutting the people who care for our most vulnerable loved ones $68 million. And this bill allows rampant fraud in our public programs to continue. You can wave your hands and pretend like it doesn't exist, but it does. And your bill does nothing about it. Members, I can't give you a reason to vote for this bill. This bill should be thrown right in the trash and we should go back to the drawing board. And I hope the bill that comes back from conference committee can be something that we can all support, that addresses the problems that Minnesotans care about. You need to vote no today. And when you press your button, think about the promises you made last fall when you were campaigning. Because if you vote green, you will be breaking your word to your constituents. Thank you.
Representative Schumacher.
Thank you, Madam Speaker and members. I'm just sitting here thinking about who might have been enjoying this long debate today, and I'm assuming it's Representative Marquardt who's the one who's probably enjoying this the most, and the fact that we'll have such little time on the tax bill because of this today. I wanted to just start out with a couple of thank yous to Chair Moran first for chairing the policy committee. I think I've said it before, but you do a tremendous job with the testifiers that come up and the people who make a trip to the Capitol and to just present their case. You do a wonderful job at making sure that they feel comfortable in the committee and have that ability to express themselves. And that's one piece I've genuinely admired about you and the work that you've done there, and I greatly appreciate that. I want to also thank Representative Liebling first for her capacity today to have all of this without having to rise on every point. I know that had to be tough for her, and I'm sure we'll get a little bit of that here. But while Representative Liebling, I've come to learn over the years, is a little bit more direct than most people in Minnesota are used to, you always know where you stand with her. And it made going through this process, through this bill and years past, a lot easier to handle because you never had to question where you stand with Representative Liebling. Really, members, what we have are just really two different approaches to the way that we should govern. We were told earlier today that the role of government is to make lives better. And I would have to question how raising the cost of health care through taxes and fees makes lives better. I'd have to ask, how does taking quality funding away from nursing homes make seniors and their caregivers' lives better, especially when DHS has reported on value-based reimbursement and said it's too early to tell if we should be making changes to that. I'd also be asking, how does ignoring the expensive fraud and child care make the lives of honest families in the system easier? On this side of the aisle, we would have taken a different approach because we believe that the role of government is to promote earned success, that we should be creating a safety net, not a safety hammock, and that having success that a person can put their name on and celebrate is the best way to go with our policy. Taxing people when they get sick because they got sick is nothing that encourages earned success. In fact, the regressive nature of the sick tax punishes people for their success. And if you're questioning whether the tax is regressive or not, the Center for Fiscal Excellence found that if we did allow for the repeal of the sick tax to go through, that the state's overall tax policy would become 20% less regressive if we move forward with that. But we don't do that in this bill. And it doesn't advance earned success when we learn of fraud in child care and we don't do enough to reform it. Now, yesterday, Representative Hlth challenged me to find some good things to talk about the bill, so I went through the bill and I found 14 things that I really liked about the bill that I wanted to just touch on briefly here. The first one is a bill that I've been interested in for the last 4 years and have had a chance to really get into this year, and that's the issue of swing beds. And I've presented in committee on behalf of Representative Liebling before. I've been working on this off and on for the last 4 years, and just really appreciate the fact that Representative Liebling brought that forward, that Representative Moran would hear the bill, because for 4 years on this policy, all I've heard is that we'll be working towards a compromise, not really understanding that when you have the status quo, you have no interest in trying to find a compromise that disrupts that. And after 4 years of being told that, I finally had enough. I've been very frustrated with that process overall, and I think that it's time, and I'm glad to see that in this bill, we changed the swing bed rating to 9,125 bed days this year. Really, the issue for that comes down to patient choice. When a patient has the ability to choose where they receive their care, they're getting the kind of care that they want to have. And when we cap the number of bed days at 2,000 bed days for patients, we aren't allowing for patients to have that choice. And after a couple of events in my own family's life over the last 2 years, over the last year, I learned just how personal and how immediate that can happen when we limit arbitrarily the number of bed days that we have in this state. And I would just ask members, when they're considering this, how they would respond to a constituent who has their choice limited because of an arbitrary law, what they would say. Now we're hearing the position of the long-term care industry that an increase in swing bed days would lead to increased cost in the overall system. So does the spending that they're encouraging in this bill leads to increased cost of the system. But in that case, we aren't limiting people's choice. And so I'm sure that there will be more delay tactics throughout this issue. I'll be watching this one fervently through the rest of session. I would imagine that we'll be seeing other studies being proposed and that sort of thing. We don't have time for that, members. We know the information that we need to know. We know that patients should have the right to choose where they receive their care, no matter what kind of protectionist policies we have chosen to keep in this state. The other 13 things, just to go through briefly, Representative Moran has Heaven's Law in this bill, and we really appreciate actually all the work that was done in this bill for child protection and foster families. Representative Creech's Child Welfare Training Academy, Representative Richardson's Homeless Youth Access and Birth Record Study, and Representative Moran's Relative Foster Placement. In Article 2, we really appreciated, and I would support, Representative Dean's background check set, which is a set-aside for people who have substance abuse disorders that are working to work with people who also have substance abuse disorders. The reinstating of the DWRS 7% cut from Representative Schultz, getting that fixed, we appreciate. Representative Sandel's inmate mental health sharing for continuity of care, we appreciate. Representative Morrison's work on children's mental health. There are several bills in here that would be worth supporting. Representative Liebling's 340B prescription drug rule conformity is worth supporting. Representative Fisher's FQHC alternate rate methodology is something that is worth supporting. And the list goes on with other provisions too that we could talk about. There are good things in this bill, but overall we have just overall trouble with the fact that this raises cost on health care, that there are changes made to the nursing home rates that don't have a positive effect, and that we have fraud in the child care system that needs to be addressed more thoroughly. And with that, Madam Speaker, I would ask for members to vote no.
Representative Moran.
Thank you, Madam Speaker and members. I'm going to be brief. Too many Minnesotans are struggling with the high cost of health care and prescription drugs. Thousands of Minnesotans struggle with insurance they can barely afford. That doesn't provide the coverage that they need because of high premiums and high deductibles. Families, children, individuals all matter in this state. As DFLers, we do believe that government has a role, maybe even an obligation or responsibility in making people's lives better. This bill speaks to this value. Whether it's keeping Minnesotans healthy, improving health care, and controlling costs, looking out for people with disabilities, combating the opioid epidemic, investing in giving children a great start in life through the Child Care Assistance Program, strengthening and supporting family preservation, promoting health equity through culturally competent doula programs, mental health approaches, and investment in community solution. This bill makes people's lives better. I really want to thank my committee administrator, Chris McCall, and my committee legislative assistant, Alyssa Fritz. I could not have chaired this committee without you. You guys are awesome, and I really, really want to say thank you. Members, in any bill this big, it's not easy. We have to make choices. But this is a good bill that does so much good for so many people across the state of Minnesota. And I am happy to say to the members in this body today, please support House File 2414. Thank you.
Representative Liebling.
Madam Speaker and members, I'm sure everybody's going, finally, the closing is coming. Yes, it is. Only about 3 hours after we thought it was going to come, but nevertheless. So I've been sitting here listening to members of on the Republican side, and it makes me wonder what bill they're talking about. You know, I know you guys are great at messaging. You're great at messaging. You pick some things and you say them over and over and over. A lot like President Trump, actually. A lot like him. He's good. Message. But you know what? Just because you say it over and over doesn't make it true. And just because you might yell sometimes and get really passionate, put on a good show, that doesn't make it true either. And a lot of what you said about this bill is not true. And in fact, your main message on this bill is false. False, false, false. And I know the speaker wouldn't like it. I could stand here and say it a lot of times. I could do that. I'm not going to. But you guys, you're real good at it, but you're wrong. Because this bill saves healthcare costs. It saves healthcare costs. You know, if you own a business, you know that just because you spend money improving your business doesn't mean that you're just out money. It means that you're improving your business, that you do it for your future. You know that it's not a matter of how much you spent improving the facade of your storefront. You know that it's going to bring more people in the door. So, you know, you focus on just how much you're spending, then it'd be like, what a failure of a business you've got. Well, we have a system that works very well and has been working very well for over 25 years when it was put in place with a bipartisan agreement. And it has held for all of those years. And it should continue to hold because it saves healthcare costs. But that's not the only thing in this bill that saves costs. We heard from Representative Howard very passionately about what this bill does about insulin. This bill does more than that. This bill saves costs for people because it finally gets after the cost of prescription drugs. And that is a huge driver of costs in our healthcare system. And more importantly, the cost of healthcare, the cost of prescription drugs is actually killing some of our Minnesotans. And it's harming the health of others, and that increases healthcare costs. So this bill is reducing the cost of healthcare. This bill is also reducing the cost of healthcare because it does sustain the Healthcare Access Fund, removes the sunset on the provider tax. And I'm not going to go through the whole argument again, but I do want to tell you that if you vote against this bill, we've heard a lot about how we should go and talk to our nursing homes. Well, everybody who plans to vote against this bill, if you have a rural hospital, go talk to your rural hospital. See what will happen to them if the provider tax is allowed to sunset. Go talk to your rural hospitals, the ones that you fight so hard to sustain. I want to refer back to the testimony from the Minnesota Hospital Association that we heard, I think it was in the tax committee. And the representative of the Hospital Association said that she's asked by many legislators about the impact of the provider tax on the rural hospitals. And here's what she said. First of all, the provider tax is not applied to any Medicare services. In rural hospitals, 50 to 60% of their business is Medicare. So much of their business is not being taxed. Also, that the provider tax has been recognized by the federal government as an allowable cost for critical access hospitals on their Medicare cost reports. So they get credit for what they do spend on it. And finally, that rural hospitals have small volumes of patients. So even a small uptick in the number of uninsured patients can be devastating for those hospitals. And so what happens if the provider tax goes away? We know that it directly supports about 200,000 people on our public programs, but we have 1.1 or so million people in Minnesota who are on our public health care programs. And if their care is jeopardized, what happens? The rural healthcare system takes a big hit. So I wish all of you had the time to go out and talk to your small rural hospitals before you take this vote. You really ought to do that and see what they think about it. And as we pointed out, something like 165 different organizations signed a letter saying that we need to keep the tax, and a lot of those were hospitals. So I'm not going to belabor the point, but just think carefully when you vote against this bill. There are so many other good things in this bill. The GOP has focused on nursing homes. Let me just concentrate on that for just a minute. Representative Schumacher just gave a lovely speech, and he talked about the swing beds issue that I bet a lot of you probably don't understand that issue too well. But one of the things that he said, he and I agree on that, he questioned what is being told to everybody about the swing bed issue. And guess what? The people that are talking to you about the swing bed issue and saying, oh my gosh, the nursing homes are going to go under if you do this, they're the same ones who are telling you what their data is on the so-called cut to nursing homes. The same people. So are they really credible? I would say to you, they're not giving you the whole story. Now, a few years ago, yeah, we bipartisanly, we recognized that nursing homes were in a difficult situation. We completely revamped the way their funding is done to this thing called value-based reimbursement. Well, the important word there is value. Value. This was supposed to be a reform that would not only give them money to help raise wages, but would drive quality. Members, anytime you do a big reform, you're going to have to come back and tweak it. You got to see what happens, and you got to tweak it. And that is what is being done in this bill. It is tweaking that big reform where they got lots and lots of new money, and it turns out the quality is not getting better. That's what's going on. So your big message about all the cuts to nursing homes, the nursing homes are still going to get raises year over year over year. And they're going to get these raises, and they're going to getting more money year over year over year in terms of percentages than any other part of our long-term care system. So if we want to have a sustainable system, we got to make sure that we give parts of the system what they need, that we make sure that wages are reasonable, that they can hire employees. We know that's just going to get harder, but we can't afford to give buckets of money to one part of the system and let the other parts of the system starve. We just can't. And I'm so surprised because usually Republicans want to be fiscally responsible. And in this case, buckets of money, hey, no problem, because the industry says it's great. Well, of course they do. Come on. So finally, I got to say, in terms of this, that we heard a lot from Representative Pinto, and I am certainly grateful to him for the work that he did in the Early Childhood Committee. When you vote against this bill, you are voting against very strong, good program integrity, accountability measures in our child care program. And our child care program is extremely important to many of the working families in this state. And getting rid of that program would be just a travesty. So we are strengthening that program, we are putting money into that program, but we are also paying attention to program integrity and making it better. So, many people have talked about the wonderful things in this bill, and indeed, there are many wonderful things in this bill. I could go and talk for a very long time, as you all have, about this bill, because there are tremendous things in this bill, and I appreciate that Representative Schumacher mentioned a lot of them. I do want to mention that there is a tremendous amount of assistance in this bill for the disability community. Now, Representative Dowd talks a lot in 4-year numbers, so I'm going to match him and talk in 4-year numbers and give you a few of them. For over 4 years, for the disability community, what we call the disability waiver rate system, these are the same people that were complaining about the 7% cut, we are investing $133 million over 4 years. That's what you're going to vote against if you vote against this bill. PCAs, personal care attendants, the people who take care of a lot of the most vulnerable people, allow them to be in homes, out of institutions. Many of them can't survive without a personal care attendant. We are putting in $75 million over 4 years. And on what was called the MA-TEFRA program, which is an acronym nobody understands, this is a Medicaid buy-in for families who have a child with a disability. They have private insurance, and it doesn't cover the things their child needs. So we have a buy-in program. They can buy into Medicaid to get extra services their child needs, and they pay a fee to do that. And we are investing $5.6 million over 4 years to reduce the fees that they pay. So there are many, many great things in this bill. And just to close, I want to let you know that this bill obviously it's large. It does a lot of great things. It was not dropped on your desks moments before you had to vote on it. It was received, at least 80 people testified on it over 3 days. It was posted for 9 days. And by the way, it doesn't weigh anything when you read it online, which you can do and word search it. And it contains at least 45 provisions that were left over from Omnibus Prime, either the same ones or modified. So this is the work not only of this session, but of the last session. We had to redo a lot of what was left undone. So we didn't drop it on your desks with no time to read it, and of course our debate today shows that that is the case. So members, you should be voting for this bill, because this bill reduces health care costs, it takes care of our most vulnerable, and it makes a great step toward the future of allowing every Minnesotan to get the health care that they need, when they need it, at a price they can afford. Vote yes.
The clerk will take the roll. The clerk will close the roll. There being 74 ayes and 55 nays, the bill is passed as amended and its title agreed to. Representative Winkler.
Madam Speaker, I move a recess to the call of the chair until 9 p.m.
Representative Winkler moves a recess to the call of the chair until 9 p.m. All those in favor, please say aye. Those opposed, please say no. The motion prevails. The House is in recess.